the audio, like, can we get the audio going over the speakers so that Dr. Chamber and Ryan can hear? Do you want one thing to spill us? Son? Try that.
Test, test. Test, test. Sorry, just doing some council chambers troubleshooting.
What happened with the groundhog today?
If the am I on the speaker?
Yeah, you're here. I can help.
To me. Oh no. Sorry. Like people can't hear me.
Hi. I would like to ask Deputy Chair Van Passen to call the meeting to order.
With 1 minute to spare, he stepped away.
I'll
Mr. Burgess, is Councillor Van Passen in your neck of the woods there? Kevin was just chatting with him.
Yep,
Oh, there he is.
on screen.
Yeah, I just phoned with the mayor and she is unavoidably detained. So we will call a meeting to order. So now I'll have to go and could somebody
yeah. I'll forward you. I'll print some notes off for you.
recess minute?
I'm just getting some notes for the chair, and I'll be right back.
Okay, Kevin is just picking me up our little formal opening the meeting speech that I haven't quite memorized yet. So. Thank you. Okay, we could reconvene our Board of Health meeting from February 2nd, 2021. And I would like to remind everyone that our meetings are web streamed and televised, and would ask that you ensure your phones are on silent mode and keep your cameras on mute and yourself when not speaking. And of course, remember to unmute yourself if speaking. Please use the Microsoft Team raise your hand feature icon to be called upon. and remove it when you're finished speaking. We begin today with Board of Health meeting. The public hearing meeting begins at 3 o'clock, and we will determine whether to proceed with the special council before or after the public hearing meeting once the Board of Health concludes. So again, I will recall the Board of Health meeting to order and look for a motion for approval of the agenda. See, Councillor Taylor, seconded by Councillor Michelli. All in favor? Carried. Any disclosures of pecuniary interest? Seeing none, we'll proceed with the presentation from the Medical Officer of Health. So I will turn it over to Dr. Nesatari.
So thank you, members of the Board of Health, Vice Chair Van Passen. Thank you for allowing me to speak today. At the onset, I want to share some general remarks. I'm going to talk about data today. The one thing I would share is that no single data element should be considered in itself, and it's most important to consider it in its context. Secondly, like whenever we deal with lots of data, every so often we get the numbers wrong. So if I misquote a number, we can always correct that. But you will see that I have lots of pieces of paper on my desk today to talk about data. The second item I want to share with you is that COVID-19 is a new disease. A year ago, none of us really knew about it. And so we're still gaining more and more experience in COVID-19, and what we say today may be modulated by our experiences moving forward. So the first question is, where are we at the health district with COVID-19? There are approximately 1,300 cases in the health district since the beginning of the pandemic. There are 38 deaths. There have been additional deaths since the last time we had the Board of Health meeting. We see cases, individual cases in the community, but we also see clusters of cases in households, and we see outbreaks at long-term care facilities and retirement homes and other congregate settings, including farms, and we've had a few farm outbreaks in recent memory, and we've also had outbreaks at group homes or residences for people that suffer from intellectual impairment or experience intellectual impairment. So we continue as a health district to experience COVID-19. The average number of cases in more recent times is reduced, but the one thing I would always share is you really have to look at the last 14-day average to sort of get a good insight, I think, on where we are for burden of illness. Province-wide, there were approximately 2,000 cases yesterday, and there were 6,200 deaths in total. Canada-wide, there are approximately 20,000 deaths. I asked Kevin, and I didn't realize that everyone would be virtual today, but I asked Kevin to show you this. And what this is you'll see two asterisks. And I hope this can be seen. There's no way to project this, Kevin. I said, oh, there we go. So the point of the matter is this is the number of cases of COVID-19 since the beginning of the pandemic. And at the beginning, you'll see, a few hundred cases a day, and you'll see that we've had many more cases, and I think we exceeded 4,000 cases on one particular day. When you see the two asterisks, one asterisk represents where we were as it relates to the number of cases at the beginning of the pandemic, at the beginning of the lockdown in December, and where we are today. So we are about, if we look at the number of cases as the metric across the province, then we're about where we were at the beginning of the lockdown. Um, this slide, and I want to be sure we have the same slide. Yeah, it's the one with the deaths. So if you can hold it up, Kevin, that's great. So if you notice this slide, this is the number of deaths of COVID-19, and number 1 represents the number of deaths early on province-wide. And on one particular day, it exceeded 80, but if you look at the trend, there was a whole number of days where it was between 60 and 70. If you look at where we are now, the trend suggests that we are, in the 50s and maybe in the 60s for the number of deaths. The last week average of deaths ranged from a low of 36 to a high of 73. So my point with telling you, sharing these data elements is in fact that as it relates to case counts and deaths province-wide, we still struggle with this challenge. And Haldeman Norfolk is not an island, for sure. The other data element that I want to share with you is that we have the number of cases, we have the number of people who die, and then we have the number of people who go to an ICU bed. And Kevin has on third page number 3, and there's an asterisk to the bottom right. And this number is a daily number. So there are currently in this province 698 patients on a ventilator. And of that number, 277, about 40%, a bit more than 40%, are with COVID-related patients. Why is that important? Because first of all, if you go on a ventilator, it's not a pleasant place. It's not a pleasant clinical experience for sure. But also, as we crowd out ventilator space with COVID patients, that means that other groups of patients who might benefit from ventilator services or ventilator beds would not have access to it. So it goes to this core theme of how much access can we have in the healthcare system as it relates to COVID. We also face, thanks Kevin, I appreciate it. We also face this other challenge, which is that we now see mutations of COVID, and we always expect viruses to mutate. There's the United Kingdom variant, or the UK variant of COVID, and this variant is more likely to lead to people getting infected, so it's more infectious, and it likely has a shorter incubation period. So what does that mean? Ultimately, that means that this may result in any one exposure for more people getting infected and more people getting sick, and potentially more people dying as a population health approach. So what can we do, and what are we doing to try to mitigate this? Well, I think we really have three approaches. The first approach is we need to do case and contact management. What does that mean? It means that if we find someone who's got COVID, we have to work to try to make sure that person self-isolates, and we have to identify the people that they might have infected, the contacts, and put them in self-isolation. And this is particularly important with the new variants of COVID. I expect that we'll have to spend more resources as we have the UK variant on board. The preliminary evidence suggests that if we know that someone's got a UK variant, the recommendation would be to perhaps do more testing on these individuals, be more assertive in contact management. So this is ultimately going to require more human resources to achieve this goal. We have to manage outbreaks at congregate settings. We have to manage them, and that's at farms, at homes for people that are intellectually impaired, at lodging homes, anywhere where people share bathrooms, kitchens, and bedrooms. We have to put our efforts to manage those outbreaks. Those outbreaks are the most likely are greater when you have more people living together. In this health district, we've obviously struggled or suffered with people living in congregate living, and some of those have resulted in death. We have to roll out the vaccine. And the number one risk factor for of suffering an adverse consequence of COVID is age. And I have some numbers here I wanted to share with you. So, of the deaths reported in Ontario, there were 6,224 deaths, about 6,200 deaths. Of that, 4,300 of those deaths were in people over 80. Then there were 1,600 deaths of those people over between 60 and 79. There were 233 deaths in people 40 to 59. There were 23 deaths in people 20 to 39, and 2 deaths among people who are under 19. COVID is a disease that ultimately kills older people. And if we're running a public health service where we're running a population health program, then we have to focus our resources on the people who are most likely to benefit from intervention. So when we vaccinate people, we have to think of, well, what is the provincial guidance, which is what we follow, but also what is the guidance that we can give the population overall, the community overall. And I would submit that we have to get vaccine to people who live in institutions, long-term care and retirement homes. We have to get vaccine to community living elderly people. We have to get vaccine to healthcare workers. And we have to roll this vaccination program out. Now, the province has given its direction, and we are trying to follow that direction. So where are we today? Where are we today in Haldimand and Norfolk? We have vaccinated, there are 18 long-term care and retirement homes. Marlene, the public health nurses, the team, emergency medical services, medical directors of nursing homes, nursing home administrators, retirement home administrators have all worked together. And we have vaccinated the first vaccine for all of those people. So people who live in institutions who are elderly have got vaccine. They've got their first dose, and their second dose will be coming, and that'll be starting again this Wednesday, and we'll be mounting a full court press to try to get the vaccine out as quickly as we can. The second group of people are workers who work at long-term care and retirement home. Those people will be vaccinated on day 35. We have enough vaccine for those people. We have to think about how we're going to vaccinate the community, the 110,000 people in the health district. So the Public Health Service, working with our partner agencies and community physicians, has articulated a multimodal distribution plan, meaning that it distributes through multiple channels: physicians' offices, community health centers, mass vaccination centers sponsored by the hospital, sponsored by the Public Health Service, sponsored by family physician groups, the family health teams, a multimodal redundant strategy to get people vaccinated quickly. And we received permission this past weekend to vaccinate a community of elderly community living people. And today we vaccinated 100 of those people in Victoria. Why is that important? Because we're a rural health district. We need to be able to vaccinate people that's in strategies that are consistent with the rural health district. Now, it is true that we were initially approved for 500, and I'm grateful that we received that approval. Yesterday, that was on Sunday, and that approval was adjusted to 100 yesterday. And I expect by the end of the day today, we will vaccinate those 100 people. I think Marlene would confirm that, but Marlene and I were over at the vaccination center, and that was a concerted effort of many people. As exciting as it is, or as positive as it is that we can vaccinate people in the community, the real goal is for this center to be replicated so we can scale it up, so we can vaccinate more people. And that's the reason we did this test today. It was a pilot run. There are thousands upon thousands of elderly people in the health district. Um, um, and we hope that this test run will allow us to see how we can do it better, how we can perfect it, and ultimately generalize that approach. So what is the end game? Well, the end game, I think, is assuming that the virus remains vaccine sensitive. If we can vaccinate the broadest population, we will have a bit better control of COVID-19. And hopefully by the fall, that we'll have some level of returning to normalcy. I want to leave you with something which I think is also a positive. So vaccination is a positive message. It's a continuing message. We need the Board of Health to speak positively about vaccination. Emotion, anytime there's a rationing or or shortage, there's always emotion involved with it. We anticipate that we'll be getting more and more vaccine over these next few months, and we'll continue to vaccinate. I want to leave you with something which I think sort of shows innovation in the health district. One of our challenges was, and it's been a challenge worldwide, is what happens, ventilators are in short supply. And our colleagues at Battlefield made this artificial bagging device, which acts as a ventilator equivalent. And here it is with all of its bells and whistles. Now, 3 years of medical school, 5 years of residency, and it's still sort of learning this technology, but here we go. So, it's a... All right, well, I'm not going to burden you with the sequence of events to get the ventilator going, but this is the ventilator. It's got a computer-controlled device. It will act as a ventilator substitute. So what is the advantage of this device? Well, if we don't have any other opportunity to ventilate people, this device will ventilate patients, and it will do it. It even has battery power. The ventilator is not the solution to COVID-19, but in some cases, it can mean the difference between someone living and dying. So if we ever run short of ventilators, at least we have this as an additional resource available to the health district. If I could say, and I think this is also some part of innovation, is the original design from this came from the Massachusetts Institute of Technology. Our colleagues at Battlefield perfected it, refined it, and I think it's a wonderful contribution to the battle on COVID. So with that, I'm sorry to have been so long-winded today. I'm happy to answer any questions, and we ask for your continuing support on the public health service from the Board of Health.
Okay, any questions from board members? I see Councillor Columbus.
Yes, thank you, Mr. Chair. Thank you, Dr. Necessary, for that update. And I think we've all been following it on our regular newscast daily. But having the local scenario put before us is great. My question is with respect to the migrant farm worker program. I would expect that you're having continual meetings with the Ontario government and perhaps the feds. Where are we? I know some farmers are getting ready to have workers come soon. And where are we with respect to the migrant farm worker issue that whereby the has to cooperate with isolation plans, et cetera?
Right. So I think since our last board meeting, there have been 3 outbreaks at farms. One of the outbreaks spanned Christmas Day, and we had the team there to manage that outbreak as well. I think the risk of COVID-19 infection among within the residences of migrant farm workers is likely to be greater this upcoming year than the previous year, in part because COVID overall has a greater prevalence in host countries, and with these new variants, which potentially could be more infectious, we could see more widespread disease. I have been in contact with federal officials, most recently last week. We have argued, we have advocated for the federal government taking over the self-isolation period, and 6 other medical officers of health have also said that. This is public record. This includes the medical officers of health in Windsor, Essex, Brant, Durham, Niagara, Chatham-Kent. I think I'm missing one. And the chief medical officer of health has also written a letter to the federal government asking for the same. The operational details, the health district continues to approve self-isolation plans and continues to try to provide support to try to keep the community safe, recognizing that outbreaks in farms also create outbreaks or disease spread within the community, people who don't live on the farm. So we're continuing to work on trying to provide those services, recognizing that it requires resources from the public health service. I think that what will the consequences be of diminished air travel? The federal government, I believe, has curtailed air travel to certain nations, including Mexico and the Caribbean. What will the consequences of that be for travel? I think the federal government, will wait for additional guidance from the federal government on how that is managed. I think we can ask the federal authorities about will this restriction on air travel include charter flights? I think that remains an open question. So, in a nutshell, we're continuing to have dialogue with federal officials. We continue to get the updates. We continue to provide support to farmers and farm operators as we continue to try to manage the pandemic within the resources we have.
Thank you, Doctor. I appreciate the update.
You're welcome.
And Councillor Martin, is that your little hand icon that's up?
Thank you, sir. That is my little hand icon. Through you to Dr. Necessary, on that original chart that we were shown with the double asterisks demonstrating really no notable changes throughout the lockdown overall, despite the fact that businesses are closed and so many people are staying home and schools aren't in, et cetera, et cetera. What I think the main goal is here, that we're all striving to get out of lockdown for mental health purposes, for economic recovery purposes. But I guess my question to you is, what level of advocacy on the provincial level do you have when not only our health district, but so many are producing that same number to say to the province, what we're doing isn't working and we've just extended it, and where do we go from here? Because it seems like a lot of wasted time, and we're not really producing the outcomes I think we all hoped that a lockdown would produce.
Yeah, I think there are many ways to interpret the data set. When I look at this, I think that we had a peak in the number of cases after the lockdown, and then we've had a reduction. That's 14 days or one incubation period. That would be sort of a rule of thumb to see if your intervention has an effect. So, there was one day where it hit 4,000, and there were other days it hit 3,800, 3,600, and we're now less than or around 2,000. So I think that one could impute some benefit from these more assertive public health measures. It's always a balancing act between what is the level of containment one wants and what levels of public health interventions does one want to place on the broader society. And that is that's a difficult ethical construct or conundrum to deal with. You know, I do advise and I do share my perspective with provincial officials. At the end of the day, many of the directions as it relates to things like schools are provincial decisions. They're not local health district decisions. As it relates to what businesses open and don't open, for the most part, that's a provincial decision. But we do share our perspectives. There are 34 medical officers of health, and we do share our perspectives. I think they're given some consideration in formulating public health policy. Like with any other group of diverse people, we have differences in opinion, and we try to, you know, try to effectuate the best possible plan that we can. So, I too am concerned, and I think I've said this before. The one thing that I think is a priority, and this is my perspective, keeping schools open for little children, for young people, is a priority, because for many children that is one of the most important things that advances social engagement, participation, equality, all the things that we really value. It is less important to have other activities, so it's a trade-off. So would I choose a hockey arena versus a school? No, I think that given that choice, I would pick the elementary school. Those are policy choices we all have to make. Do I think a golf course versus a school? I think I'd go with the school. Because at the end of the day, a lot of the public health interventions are about minimizing human-to-human interaction. And I think that that we can make priorities, and I don't always agree with the priorities that are formulated, but we try to support them. So I think moving forward, I think it's a healthy dialogue to think of what are the human-to-human interactions we have, and which ones can we, as a society, perhaps live without, and which ones do we think that are most important. And I'm sorry for being long-winded on this, Board of Health member Martins, but I am very concerned about young people losing one of the most important years of their life, which is what this past school year has been. It has attenuated their educational experiences, both from a content point of view and also from a social learning and development point of view. My apologies for being long-winded. You caught me on a very a topic that is close to my heart.
No problem. Thank you for that. I guess I didn't expect, that there was going to be any significant changes to the overall lockdown and implementation of that and the regionalized approach and so on. But it's shocking to see the numbers, and I would have thought that it would have progressed a little bit farther. So anyways, that's just, I guess, good, healthy dialogue, like you said. My second question is there a specific window of time between the first vaccination and the second vaccination? Should there be any additional hiccups of the second implementation where it isn't going to be as effective or isn't effective at all if you get the second dose too late? And further to that, what is the big picture next steps, if any, have been articulated to you at all after long-term care and high-risk populations are given the vaccination? Do you have any comments or information on what that would look like in our communities?
Sure. So your first question again, just prompt me. The first part.
Sorry about that. Is there a duration where if you wait too long to get the second part of the vaccination, that it's problematic?
There are two vaccines that are currently approved. One is the Pfizer vaccine and one is the Moderna vaccine. In this district, we have the Pfizer vaccine. In part, the reason we have the Pfizer vaccine is because the hospital purchased a freezer in anticipation of that arrival. So that was a positive. The Pfizer vaccine you could give at 21 days. Now, in my estimation, most of the benefit is likely from the first injection. The label, the instructions for use, or the guidance from the manufacturer's 21 days. In fact, that can be extended and probably give additional benefit at a longer period of time. And the latest provincial guidance, I believe, is 35 days for healthcare workers. I'm not particularly, everything in medicine is about a risk-benefit decision, and I think that extending it is okay. Quite honestly, if I would sooner give people their first dose and get more people vaccinated and delay some people for their second dose, given that trade-off, that would be my preference. I think that's been consistent with the provincial guidance as well, by extending the dose for people who got their first dose. So I hope that answers the question. The second part of your question, Board of Health member?
Is there any indication on rollout after we targeted high-risk individuals, long-term care, retirement homes, and that's fully done? We've gone on to workers, healthcare workers, essential workers. Is there any information you can share with us at this time about the rollout of the vaccination to the general public at large? Do we have any information about that yet?
Yeah, I think that a more, first of all, it's always changing. With those caveats, it's always changing. But I would think that as the spring rolls out, as we get into the spring, that we'll be vaccinating larger numbers of people who are part of the broader community. I think that's likely. I think that at the end of August, that's the target. August 2021, I think, is the target for vaccinating the vast majority of people. I think our strategy, there are things that we can control and there are things that we can't control, the health district. So we can't control supply. But as soon as we get supply, we want to roll out and distribute as quickly as possible. That's our strategy. As we get it, we want to distribute it. We want to keep as little as possible in storage or in the freezer, recognizing that after you get your injection, it's going to be a couple of weeks before you truly get benefit for immune response. So, but I would say the spring is when we're going to do more general rollout, is my guess.
Okay, and I see that Councillor Rabbits has been able to join us. Did you have any questions for the mental health, Councillor Rabbits?
Yes, I did. Thank you. And through you, I don't see myself on the big screen, so I might want to get me pinned. Thank you for that. And through you, my question to the medical officer of health. I wanted an update with some important dates in February. It would appear that we seem to be a good 2 weeks behind in a lot of our public health measures in terms of coming out of a lockdown or proceeding through the color codes. I think that's in large part due to some decisions at the provincial level with regards to large outbreaks. And I'm thinking back to our farm and long-term care facilities. And it just would seem to be a trend. And I sort of wanted a comment on that trend from your perspective. But I was also hoping to have some dates where more information would be brought forward in February with specificity to kids returning to school. I know our health district was in a different position than many of our neighboring municipalities. And I was hoping for some key dates that's been communicated to you in February, where we can either expect another announcement or if it is set in stone when children will be returning back to school in our health district. And I was just hoping for some commentary again on those key dates and the trends that you see emerging with regards to public health measures as it relates to our health district here in Haldimand and Norfolk.
No, thank you. So the decision of when schools open or they don't open is a decision made by the province and Ministry of Education officials. They do take public health input, and I have been called in the past to offer at least my understanding of the perspective from a local burden of disease. A couple of, so if I could share, I don't know any specific dates, but I would expect that I might get a call this week and perhaps give some advice again. But the decision is a provincial decision, and it's modulated by a number of very complicated factors. One of them is our health district is one half of a school district. So the reason one closes or opens schools or modulates school openings is because you're worried about the chain of transmission. So the chain of transmission could be from a school teacher to their child. That child goes to another school. That child gets sick. That child then transmits it to a family member, and from that family member it goes to a grandparent. That grandparent goes visits their spouse in a retirement home or a long-term care facility, and now you have an outbreak. So it's breaking that chain of control or chain of transmission. The health district, one of the challenges that we face in this health district is that we split between two different school board, two different health districts. Brant and Haldimand Norfolk Health District are all within the Grand Erie School District and the Catholic District. So it's not practical to open up one half of a district and another, especially when many of the workers are coming from other more endemic areas. So if you have a whole group of people who come work at the district who live in a more high-risk district, that's one more challenge. The second issue is that, and this is very much a contextual issue, and I was on the phone with ministry officials on this earlier in the pandemic. Once COVID gets into a school, you have to worry about the cohort. So right now, we educate young people within their cohort. They're not supposed to interact with any other cohort. So if one cohort is exposed, then only one cohort is likely to get infected and sick, and therefore that one cohort can be dismissed or excluded from school. Here's a particular challenge in Haldimand and Norfolk, like other health districts. 40% of the young people take the school bus, which is substantially more than urban districts. And in Haldimand and Norfolk, because of the rural nature, the children and young people are on the buses for extended periods of time. And they transfer buses in certain cases. They go on one school bus, they go to a school, they congregate again, and then they transfer to another school. So the level of cohorting that one would have in a rural district is different than an urban district. So that also modulates potentially public health decision-making moving forward. I think ultimately Ministry of Education officials have to balance all these competing risks and try to formulate the best plan that they can for schools. And hopefully, I anticipate that they will review this and make the best decisions that they can. The one other confounder to this is that how widespread are these new variants going to be, and is that going to affect the school transmission? And that remains also an unanswered question, and I think we'll just have to wait and see where that might take us. So I'm happy to speak to you privately if there are any dates that you're aware of that I'm not, but as of now, I'm not aware of a specific date, but I haven't checked my emails since this morning. So I hope that helps, Board of Health member. And you can always call me, and I'm happy to chat about what we know at that point.
Okay, and to Ian's comment, we had some technical difficulties at the beginning of the meeting, so I don't have everybody pinned like I'm supposed to. It's just whoever's on the screen. And right now, like Councillor Michelli is not on my screen, but if anybody wants to wave, get my attention, or just butt in with your voice and ask Councillor Michelli, I can see you now on a little screen of a little screen. So go ahead, please.
Thank you, Mr. Chair. And maybe just before I ask my question of Dr. Nace, I'm wondering, there is a white rectangle box to the right on my screen, and I don't know if anybody else has that box on their screen. If not, then I'm curious and in any event, when I hover over it, a box at the bottom of my screen comes up. It says Jacob Robinson. So I'm wondering if that's something that our clerk or Jacob in the background can take care of, because that white box is almost always on some important item that I'm trying to view, and I kept thinking it might disappear, and perhaps that explains why I'm not on your screen.
I just sent a message to Kevin about that, and he forwarded along to Jacob. We're seeing Jacob's entire computer screen, and we normally just see the Teams app.
Okay, so does everyone have this box I'm talking about?
There we go.
So Councillor Martin, board member, does everyone else have this white box?
I don't. I'm not pinned to the screen.
Whatever
Okay.
just happened, fixed the box and pinned council members for me.
Okay, so it did not do that for me. I can see you, board member Martin, clearly. You are in the full screen, but that white box is still there. In any event, I will leave it to our staff to figure that out. I just want to make sure it's not some error on my part, which is always possible. Mr. Chair, may I ask Dr. Nasathiri my question?
Yeah, go ahead. I think we have our technical. My screen keeps changing. It keeps freezing up. It keeps doing a lot of weird things. So let's just carry on and get.
Okay, well, we'll do the best we can. Thank you. Can everyone else hear me?
Yes.
I'm getting
Okay,
heads
thank
up
you.
and their thumbs up.
I will trust that Dr. Nasathiri can hear me.
Yes.
Dr. Nasathiri, thank you very much for your presentation. I just had a little bit of a follow-up question to Board Member Martin's question earlier about the rollout of the vaccinations. And if I understand correctly, the actual way that the vaccination should be done is that everyone over a period of time will actually require 2 doses of the vaccine on 2 different vaccination dates. Is that part correct?
That's right. For the vaccines that are currently approved, there are 2-dose regimens.
Okay.
The Pfizer vaccine is 21 days, and the Moderna vaccine is 28 days.
Thank you. So second is, so you mentioned you thought that the bulk of our residents in the health district would be vaccinated by August of this year. Did you mean that to be the bulk of everyone with their second dose?
Yeah, that's my. These are projections, and I'm always reluctant to comment on something so far in the future. But yes, I would anticipate that that would be the second vaccination for people. It could mean that we also may have vaccines that are approved for single dose administration, which might simplify the process further. But I would expect a complete vaccination or complete protection by August, assuming that these vaccines are successful at dealing with this and other variants of the vaccine, variants of the disease.
Thank you, Doctor. And of course, this is all going to be dependent on supply, as you mentioned, right?
That's right. It depends on what supplies are distributed to the health district.
Thank you, Doctor. Thank you, Mr. Chair.
Okay, and thank you. Any other questions? Seeing none, hearing none, could we get a motion to accept the medical officer's health update as information? Councillor Columbus, Councillor Rabbits, all those in favor? Carried. Thank you, Dr. Necessari. Now, Marlene was there. Do you have anything to add as an update, Marlene?
Thank you, Mr. Chair. I don't have anything further to add unless anyone has any questions for myself.
Is there any questions for our general manager there? Seeing none, thank you both for your information. And the next item on the agenda, we have communication report. And I wonder whether these are rather complicated things that are dumped on our lap at the last minute, and wonder whether we should defer the communications, the staff report, and an update on the previous report to a special Board of Health meeting for next week, rather than trying to deal with it at the year.
I'm sorry, Chair
Of course, my
Van
screen froze
Passen.
up.
That was totally garbled on my end. It seems I had lost audio and I saw some faces from my colleagues. If you could please repeat yourself.
Yes, please, Mr.
Yes, couldn't hear a thing.
The Wi-Fi in this building is not much different than it is at my house, I suppose. So, is it coming clear now?
Yeah, I believe you're clear now, Councillor Van Passen.
Okay. What I had suggested, we have communications from Haldeman regarding compensation matters. We have a report after that from the CS 21-10. And, I just not really feeling comfortable dealing with these that get dropped on our lap at the last second, and wonder if we would be better off to defer them to schedule a special Board of Health meeting next week to deal with CS 21-10, the original report CS 20-30, and the correspondence from Haldeman, and deal with them specifically as a one-off at a special meeting. So have some thoughts from the board members. Councillor Rabbits?
Thank you, and through you, I guess my question through you is for staff to respond and see if there is anything of a pressing nature or something that might be housekeeping that we could discuss. Some of that is quite heavy, as you mentioned. Perhaps there's something that's of a pressing nature that demanded that it be thrown at us at the last minute. So could I have a staff response, please?
Sure, I'll start. The funding was applied for back in August or September, and most of the funding, over 90% of it, should just be received. We were very successful in obtaining essentially almost all of the extraordinary funding that we'd asked for by the province. I think the issue that is causing concern for council is the issue with regards to unpaid overtime compensation for management, which was pursuant to the ministry's application forms. And it is a policy decision that, the board should undertake. We would ask for quick consideration of it because, frankly, we're trying to hire employees. Some of their top questions are how much overtime is being required and are we being paid for it? And I think we, owe clear and transparent answers both to our existing employees and, any ones that we're trying to attract into the health unit to, frankly, for the funding that we permit to add those staff on. And as you know, Councillor Huffman did send out a question with regards to existing turnover of some staff, which we'll address separately. But those turnover in management staff is something that we do have to replace. And like I said, these are questions that get asked. So if you'd like to defer it for a week, that's fine, but we can't really go much further than that because we need to move on with this, with setting a policy and moving forward.
Through the chair, I do see that the mayor has her hand up there, and she is online. The other housekeeping items is we do have the approval of the minutes if we wanted to take care of that before deferral.
Thank you. Yeah, I do see that I missed that. Can we go back to do the minutes first because your chairman doesn't know what he's doing? The adoption of the Board of Health, the minutes for January 6th, the budget minutes. Is there any errors and omissions? Seeing none. And the January 5th, 2021 regular minutes, any errors or omissions? Seeing none, then they will be considered adopted. Okay, and yes, the mayor has joined us, so Mayor Chop, would you like to comment on the question I put forward on whether we should defer to a special council meeting next Tuesday and deal with all of these reports at once rather than that I still don't feel comfortable with something that we got from Haldeman over the weekend, so.
Thank you, Mr. Chair. I guess I would say that I think, yes, we need a special council meeting. I think Haldeman should be invited. I furthermore think that we need to have an in-camera session to deal with this matter. And I also have concerns within the report that the funds that were applied for that were outside of Norfolk County's policy without council's approval or knowledge of the substantial sums that were applied for, that this needs to, again, come to in camera and that the funds are not to be paid out until such a discussion takes place with council. I am actually, I'm floored with this report, to be honest, and I'm floored that it's in open session right now.
Well, and I do believe that maybe the Christmas break, there might have been some sort of lack of forwarding information, and that's why I would suggest we just move the whole works of it to a special meeting a week from today, deal with it then, schedule an in-camera session at that meeting, and get all the information. And yeah, that's a good idea to maybe invite the Mayor of Haldeman to sit as an observer as well, or?
I think it may be prudent, Mr. Chair, if it's okay. I think it might be prudent to invite have a joint meeting with both councils. This is significant, what has been presented based on the information that we just received this morning at 10 o'clock. And I don't feel comfortable not having Haldeman involved in this decision, given the impact of it. And I believe they should also be involved in if we're going to have a significant shift in our policy in terms of how we're going to deal with this moving forward. They should partake in that discussion. So, and again, you know, on page 10, it refers to that that staff will be paying out the compensation. Again, this involves a significant change in our policy without council's authority, and I think prior to any action being taken, this needs to be addressed, the entire report by council.
And if I understand the CAO's comments, as long as we deal with it, like next Tuesday, we could put it off that long, but wouldn't want to put it off longer than that. So would that be acceptable, Mr. Burgess?
Sure.
Was anybody willing to put forward a motion to that effect, or? Councillor Rabbit, and seconded by Councillor, Board Member Rabbits, and seconded by Board Member Taylor. And that the clerk have that captured, that it be deferred to next week, that we have a special Board of Health meeting, and that we will invite members of Haldeman Council to join us as observers.
Yeah, we can certainly make those arrangements. we do have a CIC next week, Tuesday at 3 p.m. if we wanted to do it earlier.
Yeah, I think
maybe 2 p.m. if
probably
that's
the
okay.
1 p.m. on Tuesday.
Or 1 p.m. works as well, yeah.
Yeah. Councilor Martin? Or Board Member Martin, sorry. It seems you're still muted.
Thank you, rookie mistake. I would just ask that all the information be compiled and put together in one spot for us as well, with the stuff that came in this morning, and it was kind of all over the map. And I may be the only one here, but like my computer screen is way off. I'm having a hard time seeing faces and whatnot. The top box, I can kind of see everyone much smaller, but other than that, I don't know if there's something else staff can do to help with that. But I would support deferral. Thanks.
That is the same screen I got, a mini screen of a bunch of mini screens, right? So, any on the deferral? We'll call the question. All in favor? That is carried. Back to my cheat sheets. Any general announcements for the Board of Health? Seeing none, bylaw, that I have a motion on bylaw, or can I have a motion on bylaw number 2021-05 BHB and bylaw to confirm the proceedings of the regular Board of Health, Home and Norfolk Health Unit at this board meeting held the 2nd of February 2021 be approved, signed by the chair and board clerk and affixed with the corporate seal. Anybody want to move that motion? Councillor Columbus, Councillor Taylor, or Board Member Taylor, all in favor? That is carried. And
Mr. Chair, can I just interrupt for one moment? So I'm just, I've had my hand raised a couple of times, and I'm just wondering if you are able to see that.
When you are on my right now you're on my screen, right now you're not. So it said feel free to verbally interject if you would like to be recognized. So.
All right, thank you.
I can take over chairing as well for the next meeting there, Chris, and I can see everybody on my screen. I've got everyone pinned.
Yeah, so yeah, if we have a motion to adjourn, then we can deal with part 2 properly. So anybody motion to adjourn? Board Member Chop and Board Member Rabbits, all in favor? It's carried. Thank you very much for my incompetence here, but we muddled through. I suppose we should ask a question. The Public Hearings Committee is scheduled for 3, so do we want to start a special council meeting in between, or want to wait till 3 o'clock and do it after? So.
I'll go. I think it's probably, my thoughts are maybe we should just get there's only the one item for the public hearings and just get that out of the way quickly at 3 o'clock and then move into this. So take a half-an-hour break rather than breaking up the discussion.
But since it's a meeting under the Planning Act, if it's scheduled for 3, we have to start, we can't start it early, I don't believe. So
that's what I'm saying. That's what I'm saying. Let's take a half-an-hour break and then get the public hearings meeting out of the way quickly at 3 o'clock and then move into this.
Okay, we will reconvene as a public hearings at 3 p.m. Thank you, everyone.
Drew Street. Great Lakes Land and, there we go. Sorry, I got distracted there. Great Lakes Land and Farm Corporation agent Elder Plans Incorporated have put forth the application affecting the lands described as 136 Mechanic Street West. And Mohammed, I think that's you online there now.
Yes, Madam Mayor.
Perfect. Go ahead, sir.
Good afternoon, Madam Chair and the Council. This is a zoning bylaw application for a development for 3 townhouse blocks with a total of 15 units. The subject land is located in Waterford area. The frontage of the land is along Mechanic Street at the north side, and Waterford Pond is located at the south side of the subject land. The site is designated as urban residential and close to a very small commercial zone in the official plan. The subject land has two separate lots owned by the applicant. If you can, I'm going to the next slide. If you can see the aerial view of the land, there is an existing residential building at the edge of the water body, and this is owned by the applicant, and he desired to keep this as his residence. So the development proposal is creating 3 separate parts of the 2 lots he has. I'm going to explain each individual part and how actually he wanted to develop these 3 separate parts. So part 1 is the proposal of 3 townhouse blocks with the zoning change from residential type 1 to residential type 4 to allow townhouse block units. Part 2 is the remaining land for future development, and no zoning change is required for this land at this time. And part 3 is the existing dwelling, and this parcel requires a special provision to allow a private road access through part 1. I'm going to explain how actually this will happen. This is a very straightforward zoning change, but there are some steps the applicant has to go through because of the critical lot configuration. So step 1 is the zoning change, where part 1 will be from residential type 1A to residential type 4. Part 3, as I said, it will be same zone, but with the provision that that lot will have an access through a private land. So these are the changes, zoning changes this application is for. And after the zoning change approval, they have to go through several steps, which first application that will separate part 3 where the existing dwelling is from the other part of the land. And then they also have to apply for another consent application to have a lot adjustment between part 1 and part 2 to allow 3 townhouse block units. And the final step would be to get an easement from this private lot of part 1 and part 2 to part 3 where the existing dwelling is. It's a little bit critical to go through this steps, but the first step is the zoning change of this lands. We have received the agency comments, and there are no major comment was received that has any concern about this development. One of the comment was to have a turnaround at the end of the private road, and one recommendation was to have a holding provision until all these steps are fulfilled and a site plan agreement is registered. And no public comments are received for this development yet. So this report is for information, and I think Agent Mary Elder is present in the meeting, and I'll be happy to answer any questions. Thank you. Madam Mayor.
Sorry, my bad. I'm on mute there. Mohammed, thank you very much. Maybe I could just get you to put that slide down so I can see any hands from council members. And are there any questions for Mohammed before we hear from Ms. Elder? Sir Columbus, go ahead.
Thank you, Madam Mayor. Mohammed, is the existing home that's on that property that the applicant's retaining, is it hooked up to municipal water and sewer? Perhaps I missed it if it's in the report, but.
So, Madam Chair, to Councilor Columbus, yes, this property has, I believe, one connection of municipal water and sewer that is connected to that existing dwelling. But once it will be severed, then separate connection has to be required.
And secondly, the laneway that that goes to the existing dwelling on the property now, would it be treated as a street or a road or a right-of-way to the homes that are developed on that particular property?
So, Madam Chair, that would be a private road, and that is the reason we'll require a provision that a private road can, the single detached dwelling can have an access through a private road. In our current zoning bylaw, any kind of development, until it is a condominium development, it requires a public street connection. But in that case, although this is a single detached dwelling lot, R1 lot, it will be connected through a private road, and that's why the provision, special provision will be.
So I take it every one of these residences, the purchasers of these units would have a right-of-way over top of that private road. Is that, it would be a right-of-way? Is that the way it would be in legal terms?
Yes, the right-of-way will be for all the units for the development. For the existing dwelling, it will be an easement. It will not be part of the dwelling lot, but since this is a different lot, then it will have an easement that will be in favor of the single detached dwelling.
Thank you for answering my question.
Further questions from committee members? Okay, if I could have a mover to receive staff's report. Moved by Councillor Taylor, seconded by Councillor Rabbits. All those in favor? And that's carried. And Ms. Elder, welcome.
Thank you very much, Madam Mayor.
And you have 5 minutes, so please go ahead, and then we'll see if any of the committee members have any questions.
I don't think I need 5 minutes because I don't have a lot to say other than this is a good example of infill development that Waterford needs. When I was with the county, the last that we looked at the development and the need to expand urban boundaries, Waterford had a lot of properties like this that need to have intensification go into them in order to use the land that is already available. With this one, it is a condominium that's being proposed, and so the condominium would permit the owner of the lot at the back, the single detached house, to have access over it, and also to have the continuance of the servicing to go to that house. We'll see what happens. The owner's deciding on his final ideas for stage 2 or phase 2 in the part 2 of the proposal. As Mohammed has pointed out, there's certainly a lot of steps we have to go through before we even think about that. So the zoning first is the big step, and then we'll continue with the other steps. If there's any questions, just feel free to ask. Thank you.
Perfect. Thanks, Ms. Elder. Questions from committee members? Councillor Huffman, go ahead.
Sorry, I missed my mute button. No questions per se. I just want to say I've had an opportunity to tour this area and look at the plans. I'm very excited for the town of Waterford if this is able to come to fruition. I think it's an opportunity, like you said, Mary, to utilize the infill development in Waterford. And I think this is a great legacy project for the town of Waterford if this comes to fruition. Thanks.
Further questions from committee members? Councillor Rabbits, go ahead.
Thank you, and through you to Mary. Mary, I'm on the page with the layout. Let's see what page it is in our document. It's going to be page 17. I just wanted to comment the handicap parking spaces. Really glad to see those included in the footprint. And I was hoping for a comment back. I noticed it's on the length of road a little bit closer, I guess I'm going to call it, to the lake. Any comments as to why that's maybe not closer to the entrance on Mechanic Street? And maybe some comments about the width of the road, if you feel that the road needs any expanding to become an access road in case there's any unloading and loading for those residents.
Through the mayor, I believe the road access is wide enough for those kinds of accesses. The location of the handicap spaces, I think there's some more. I can't open that drawing right now, or maybe I can, but I think there's one further up as well. It's not just in that one location. No, they're in the...
Could I get you to hold for 5 minutes? We had a new rule here. If a council member's kicked off, that we would give 5 minutes. And I saw Councillor Martin had a second sign-in was trying to happen. So I'm not sure what's going on, and she's gone. So we'll just hold.
I am still here, Mayor Job. I can't see anything on my iPad, so I've switched over to the laptop, but I am here. Thank you.
Okay, please go ahead.
Okay, I now, Madam Mayor, have the layout up, and I see that the handicap spaces are in the middle between the second and third townhouse unit buildings. I think that's central to the location. I'm not sure what would be a better layout. I can certainly have our designer, Cynthia, take.
Thank you for that. And, oh, am I unmuted? I hope I am. Thank you for that. And through the chair, to Mary, just really happy to see accessible units included and space for that parking. And it was just maybe a layman's point of view that I was maybe surprised to see it not closer to the entrance, or was wondering why the location was chosen in the middle of the development. But if it adds to more of those units, it's something that this councillor is in favor of, and glad to see it included in your design.
Further questions from committee members? I don't believe we have any registered speakers, but if there is anybody online, now is your opportunity to speak up if you wish to provide comments.
Through the chair, there were...
Okay, seeing none then, if somebody wishes to move the staff recommendation or propose an alternative. Councillor Taylor, staff recommendation. And a seconder, Councillor Rabbits. Is that discussion, Councillor Huffman? Okay, all those in favor? And that's carried unanimously. Thanks, Mary, for joining us. Thanks, Mohammed. If I could have a motion to adjourn, please, from the Public Hearings Committee. Councillor Huffman, seconded by Councillor Michelli. All those in favor? And that's carried. Thank you. Okay, just give me 1 sec to get my spot here.
Hello, can you hear me? Hello, can you hear me?
Yes, but there's a significant echo on my end.
All right, how's this?
That's better, Kevin.
Okay, sorry. The council chamber sound did not work at the beginning of the meeting, so I was just wondering if the agenda had been approved as presented.
No, we haven't gone into the agenda yet, but you do still have an echo, so there must be a second recording. Councillor Van Passen's mic is off on the other room, so you must have a second mic running somewhere.
Is this better? Sorry, my speaker's not working. Oh, here, can you hear me okay now? Maybe I wasn't speaking in very well. Hello?
So is it just the issue of the agenda? That was your only question, Kevin?
The public hearing committee agenda, at the beginning of the meeting, I couldn't hear it very well. The speakers weren't turned on at 3 o'clock sharp, so I didn't catch if there was an agenda approved as presented for the public hearing committee. Just a housekeeping matter. If we could get a motion to approve the agenda as presented for the public hearing committee.
Okay, in that case, we'll now call the special council meeting to order. Approval of the agenda. We have a number of items of communications to be added. Are there any other changes to the agenda? Okay, seeing none, if I could have a mover and a seconder for that. Moved by Councillor Rabbit, seconded by Councillor Taylor. All those in favor? And that's carried. Any declarations of pecuniary interest? Okay, seeing none. To my knowledge, we have no deputations on the matter. Going into the items of communication, we have a significant list. So we'll just move this in one motion. If I could have a mover and a seconder that council received the use of the legacy fund from, and that list in its entirety. Moved by Councillor Taylor, seconded by Councillor Martin. All those in favor? And that's carried. So now proceeding on, we'll be over to the deferred motion from January 26, 2021, and that deferred motion reads as follows: that recommendation number 50 of the Budget Committee minutes be deleted in its entirety and replaced with the following therein. A, that council not accept the recommendation of staff to borrow $5 million from the Legacy Fund in 2021. And B, and that staff estimate the 2020 year-end surplus and dedicate those funds towards the 2020 operating levy. Believe there was some concerns with that second portion from staff last time. Jason, did you wish to speak to that?
Yeah, thank you. Through the mayor to council. The issue raised is we have to table a balanced budget, and we don't have the audited numbers for the 2020 surplus. We won't have that likely till June. So it's an unknown amount that you're trying to pull from a reserve for. I sent some previous correspondence around to councillors on the matter. I think it's technically better to pull from a known reserve that's there and is identifiable. And then if council then chooses to use the surplus once it's determined by the auditors to pay that loan back from the reserve, then that's the more appropriate way to undertake that. It ends you up, it puts you in the exact same spot. It just jumps you through the hoops in a more correct manner.
Councillor Van Passen, did you wish to amend your motion then?
Yes, thank you, Madam Mayor. Can I suggest the motion by deleting portion B and just deal with the item A of the motion, and wherever that goes, then we can always figure out an alternative after the fact, because if that motion passes, would take the option of borrowing the full $5 million from the legacy fund off the table.
If that motion passes, no, the motion is, yes, sorry, I see what you're saying.
Yes, it would allow another motion to come forward to change that amount or find those funds in some other reserve. So if we
or to adopt staff's recommendation still. This is to not adopt staff's recommendation.
Yes, do not adopt the $5 million loan.
Okay, Martin, I believe you're amenable to that, given staff's comments, to strike portion B.
Yeah, I will strike portion B.
Troubleshooting here. I mean, yeah, I guess if the mover is, I don't have much of an option other than to move my own motion after the fact, but just so that I'm clear, it would be, we're going to vote strictly on option A to decide whether or not we agree on the 5 million. Option B, concerning using the surplus, that can still be tabled after the fact if we wanted to disregard Mr. Burgess's comments. It's just we're removing it right now. Is that the intent?
Yes.
The intent is, the motion is that council not accept the recommendation to borrow 5 million from the legacy fund in 2021.
Yes, I'll continue to second that.
All right, further discussion on the matter? Councillor Columbus, go ahead.
Now, what if we were talking about a different amount rather than the 5 million?
This is just the first round. So that's council not accept staff's recommendation to borrow the 5 million.
Okay, thank you. And to Mr. Burgess, he's mentioned about audited statements, financial statements for 2020. What is an estimate for unaudited surplus?
Through the chair, you know, as I expressed in correspondence, it's, you know, we're in a whack of filing and refiling submissions to the province and trying to figure it out. We're going to be, you know, we're not close to being able to provide you with a surplus estimate that finance would feel comfortable with. We know we're going to be in a surplus, but the ranges can vary, you know, because how much money we're going to have to send back to the province under a bunch of these programs that got labeled because we don't actually have enough funds to put, or enough expenses to allocate to it. You know, we applied for maximum amounts. They've sent to us. We don't necessarily have had the expenditures to meet those amounts, so there's likely money going back. So it, you know, I just feel very uncomfortable guaranteeing, you know, when you're talking the quantums of $2.5 to $5 million, it's, I feel very uncomfortable guaranteeing those amounts at this early stage. And, you know, finance has just been grinding away support public health, not dealing with financial issues. So that's part of the challenge that we have. So I apologize for not being able to have a bit clearer answer. We just don't have the comfort level to put something on that. I guarantee it.
Thank you, Jason.
Further from councillors? All right, Kevin, if you'd like to do a recorded vote, we'll call the question. Councillor Martin, go ahead. I did ask.
I heard you. I'm just having some computer trouble, and Councillor Rabbits has had his hand up long before I did, but I guess if we're moving along here speedily, my question would be, through you to Mr. Burgess, that in one of the emails we initially received concerning the surplus in general, you just mentioned right now that it would be wouldn't be able to identify it until close to June. And one of the emails you mentioned, I think it was Kathy reiterated it, which jogged my memory, that it would take about 4 weeks. Is June a hard and fast, or is there a way that we're able to identify?
Sorry. Yeah, no, June is the estimate for the auditor to finalize. We're thinking April internally for the number. March, April. My two of our lead accountants are been reallocated to deal with public health projects, so that may even get pushed.
Thanks for the
But
clarification.
June is the target for the audited numbers, just to be clear, not our internal numbers.
Sure. Okay. I guess my comments concerning the actual motion before we vote would be that we deferred to ask for more public consultation, and we did get that. We received a lot of emails and comments, which is great. I went through and did a little straw poll this morning on the letters that we received, and unless I've made any errors or double counted some that resubmitted on more than one occasion. There was more than 80 emails came in. 29 of them suggested we didn't borrow. 67 suggested we did not borrow. 29 of them suggested we borrow. And then there was a few, 3 or 4 that came in with no real direction, and 3 or 4 that came in with alternate funding options. So for me, I'm going to hold strong on my position here. I don't wish to take any money out of this account, whether it's this amount or a lesser amount, and we're just procedurally going through the motions here to get rid of this motion so that we can table a new figure, because it's the principle of the issue for me on touching the fund and tapping into it, and what that message sends to future councils and so on. So that's my position on the fund. Thank you.
Councilor Abbott, go ahead.
Thank you. And through you, I did want to speak to the motion. I myself am changing my position from our last meeting. I was speaking in favor of the levy relief strategy, and I want to explain my change in position from our last meeting to today. I did speak critically of the strategy, but I suppose I was playing a bit of a devil's advocate. I'm not sure if I was trying to convince all of you or myself. I had some pretty poignant criticisms of this strategy, and maybe I think I should provide some context what led me on this journey to begin with. As your budget chair, your staff and I, along with Vice Chair Huffman, worked really diligently to try to keep the tax levy down and provide something that was affordable for our community, but would also address the financial challenges that we have. And in doing so, we ended up on 2 strategies. We ended up with a levy relief strategy, or effectively what this motion would carry, paying now, not later, and realizing all of those costs now and during a global pandemic. So it wasn't an easy process for staff or myself and my colleague, but that's where we were, and this is where we are. And so I felt, a bit tied to it in terms of trying to sell it to our community, or at least provide it as an option for debate. And I have been listening to our debate. Being in the chairing role, it's difficult to participate, though we did provide that opportunity for Mayor Chop during our last meeting to comment on the motion. Speaking directly to the motion, I was very conflicted in our last meeting, and that is why I voted in favor of deferring the matter to today. We've had overwhelming responses. I feel have been taking a straw poll in favor of not drawing from this last reserve, this legacy fund of ours. And I realize it's a losing strategy, in my opinion. I don't think we'll be able to make up another $2.5 million in cuts, along with the 5 that's proposed with this. I think it's going to be really putting us in a very difficult position in our next budget session, and I had no intention of supporting any further withdrawals from the fund to begin with. So, listening to the debate that we've had at this table and in the community, one thing on a positive light that I would like to highlight is I think this is a really healthy conversation for us to be having as a community. One thing that I've taken as a takeaway from this process is the conversations are very respectful, and we've had a lot of good correspondence sent through the proper channels and before us on our agenda for public consumption. And this is the way democracy should work. It shouldn't be a series of conversations that are or could be alleged to be backroom between individuals. We have a lot of information before us that are a matter of public record. We've asked for engagement, and our community hasn't disappointed me. I don't think they've disappointed this council. And so, I'm encouraged with the level of debate that's happening right now. We're talking about our future instead of some of the petty things that have gone on with regards to service levels and struggling to meet the needs of our community. We need to pay our fair share. And I'm listening to those at this table, but in our community when I'm voting in favor of not drawing from our legacy fund. So thank you for indulging me and allowing me to state my position and explain how I've arrived here. And I'm hoping that you found some of my comments to be persuasive. Thank you.
Further, Councillor Michelle, go ahead.
You're on mute. Sorry, guys. Thank you, Madam Mayor. 2 weeks ago, just pursuant to Councillor Rabbitt's comments, I moved the staff recommendation on this topic, which Council supported. Since then, we have had and have received a lot more information and facts from our staff that, when we made that decision 2 weeks ago, I was not aware of, and I'm sure that many of my colleagues would agree that we have learned a lot, partly from the public input that we've received over these past 2 weeks, and also from our very dedicated and able staff. I do think that with that information now, I also have found myself rethinking my position on this topic. We've heard from so many constituents on both sides, and my straw poll on those inputs from our constituents is very similar to the results that Councillor Martin came to on this question. But I'm here hoping, with that in mind, to consider if maybe some middle ground might be found that could maybe assure us a sound financial future while acknowledging the financial difficulties of some of our most vulnerable people at this, especially during this pandemic time. So I would like to see if Council has any appetite for that middle ground, and I would be at this time, perhaps, if it would be appropriate to make a motion to borrow another amount from that fund, and in my case, I'm going to propose for the moment 2.5 million for
Councillor Michelle, can we deal with the Councillor
Yes,
Michelle?
I'm sorry.
We deal with the motion that's on the table, and then
so in that case, that's why I am saying that I am also in favor of not passing this motion. Thank you.
Okay, thank you, sir. And I saw Councillor Columbus and then Councillor Huffman.
Yes, thank you, Madam Mayor. At this time, I don't want to rule out use of the legacy funds. I just think that 7.7% is not affordable to a lot of our constituents. And I have heard a great deal of taxpayers. They may not have reached us computer because they don't use a computer, but they've been long-time taxpayers to this county. And maybe because I made a public statement that I supported use of the legacy funds to offset these tax increases, perhaps that's why I received many phone calls. So, they're not people on email or social media. They use their good old telephone to get to their counselor. And those are the people that perhaps were missed in that survey, because there's a lot of people that have been taxpayers for a long time. They're seniors, and they do not use a computer to access council meetings or anything, but they do read the paper and they listen to the news. So that's my position. If there's a way that we can reduce the amount that would be utilized by the legacy funds, like Councillor Michelle says, then perhaps there's some wiggle room there to support something of that nature. Thank you.
Okay, so again, Councillor Huffman, I see you had your hand up, and then I see Jason as well. I'll just deal with Councillor Huffman and then Councillor Taylor.
Okay, thank you, Mayor Chop. Through you to yourself and to my colleagues, I've had an opportunity for what we call some second sort of thoughts, and I'd be pleased to state that I have not changed my stance at all. I do support in utilizing the legacy fund. I must concur with Councillor Columbus. I've had numerous people reach out to me on a telephone. These are seniors in our community. These are people who are vulnerable, and they're people who who have been very hard hit by this pandemic. These people aren't following anyone on Insta or Twitter or Facebook. They're following the radio and they're following the newspaper. And the newspaper and the radio are the two places that we put this information out to. So when we're looking at the feedback from constituents, I don't see this as. I have a lot of people who have reached out who've said that they feel that there's some ownership to this fund, that this was the Norfolk Power Fund and it was sold, and there's some ownership to this fund. There is an understanding that it does help with our credit rating, but not only have we hit a rainy day with this pandemic, I think we've hit a flood with this pandemic, and we need to be there for our constituents. And I don't see this as ruining the future of Norfolk County. I don't see it as me having a trust fund and dipping into it. I see it as being responsible and a good steward for the constituents of Norfolk County. Thank you.
Councillor Taylor, go ahead.
Thank you, and through you, at this point, I certainly do want to draw some from the fund to bring the tax rate down marginally, but with the outpour of folk that they don't think it's a good idea, they don't want to see that happen, I don't think I can support the full $5 million at this point, but I certainly would like to entertain another motion along the lines of what Tom was saying there. Thank you.
Jason, I believe you had a point of clarification you wanted to make.
Yeah, and this relates to Councillor Columbus's earlier question and a comment by Councillor Martin. I just want to be clear that we won't, tomorrow we're not going to go and draw anything from the legacy fund account for cash. We don't need the cash flow tomorrow. And we probably won't be drawing on any cash from that till much later in the year, past the time when you'd actually know what your audited surplus is. So I just want to be clear that, instead of guessing at the amount, we'll know what it is before we'll have any requirement to actually take money out of that, and the council then can make the decision to apply any funds that they want or change the funding of it. So I just want to be clear in that, because council approves this today doesn't mean we're taking X amount of dollars from the legacy fund tomorrow. It'll sitting that until we actually need the cash fund, which likely won't be till the end of the year. So just to be clear on that. Thanks.
Hey, Councillor Van Passen, your hand was up, or this will be your second.
Mayor. Yeah, I too bounced around with this idea, and one of my biggest concerns has always been the small business that was probably hit the hardest by the whole COVID shutdown. But I see our staff has let us know that the province has stepped in, and with the reductions in the education portion of the tax from the province, that the net tax payable by small business and industry will actually get a reduction of anywhere from 6 to 9%, depending on which path we take. So I will be sticking forth. Don't want to borrow the $5 million, but I also do have an option available depending on where this whether this motion is defeated or passed, and I'd be happy to bring that forward at that time. So thank you.
Councillor Martin, go ahead.
Through you, Mayor Chop, clarification to Mr. Burgess. So is the money being withdrawn on an as-needed basis?
Through the chair, that's correct. We have to show a funding source to balance the budget, but that doesn't mean we have to take the funds right away. And if when we deliver the year-end report, there's a surplus for that, and council wants to change the funding source for the budget, they're entitled to do that at that point in time. And that's why, that's why I don't think it's necessary for us to guess what is our surplus now. There's no real demand need for that. You can always, quote unquote, pay it back, even though we never withdrew anything from it in June.
I thought the plan from Tyler, Jason, was that there was a discussion of withdrawing some portion up front given the performance of the markets and then waiting till a later date to withdraw the balance of what was needed.
We would take it from the we would take it out of the equity market section and put it into a lower risk investment, but that doesn't mean we're actually using any of the cash out of that. We're just decreasing it. We may choose to do that anyways, frankly, within our tolerance limits to adjust our market balance. But the intent was if we were doing it, we would put it into lower risk funds prior to actually needing the actual cash withdrawn.
One further and final comment I just wanted to make was clarification for my colleagues. When I talk about the straw poll, that I wasn't trying to factor in any of the social media components. That was just a quick read through on those emails that were sent through from to us all from clerks at norfolkcounty.ca. Just those earlier numbers I referenced, just for the record.
Okay, Kevin, I think we'll call the question now then, if you can do a recorded vote for us.
All right, I'm going to do a test first. Can you hear me all right? You can't hear me?
Again, I guess I should just actually reread the motion here again. So it is that council not accept the staff recommendation to borrow $5 million from the legacy fund in 2021. Kevin, are you with us?
I am. Can you hear me okay?
Now we can, yep.
Okay. Sorry about that. There was some unmuting issues over here at the chambers. Okay. So the motion has been read. We're going to proceed with a recorded vote, starting with Councillor Rabbits.
I see Councillor Martin's hand is raised. Is there? Oh,
Thank you. Sorry, I didn't unclick it.
sorry. Yes.
Yes. Okay. Councillor Columbus.
No.
Councillor Martin.
Yes.
Councillor Van Passen.
Yes.
Councillor Huffman.
No.
Councillor Michelli.
Just for clarity, Madam Mayor, and I just want to check this. If we defeat or pass this, does that mean no other motion on the legacy fund can be brought forward?
No, you can put another motion forward.
Then I vote as yes.
Councillor Taylor.
Yes.
Mayor Chop.
No.
Motion is carried on a vote of 5-3.
Okay. Councillor Michelli, I think you were the first one that called, said you wanted to put something on the floor.
Yes, Madam Mayor, thank you very much. As I have alluded to before, I do realize, and I certainly appreciate the comments of my colleagues. We are really dealing with two groups of people here. Those that, for a variety of reasons, especially during a pandemic, cannot afford any kind of significant tax increase. And then we have other people who perhaps are maybe a little more able or willing to pay an increase in their taxes, with a view to not putting the county into further long-term debt. And so, having, first of all, being very appreciative of many of the comments that we have received. Like Councillor Columbus, I too have received several phone calls on this topic. And so as I mentioned, I'm looking for a hopeful, agreement from my colleagues about some kind of middle ground on this topic. So my motion would be as follows: that committee approve of a one-time loan in the amount of $2,500,000 from the Legacy Fund and that as outlined on page 2-94 of the budget binder, the loan be assigned a 2-year interest-free period followed by a 5-year amortization at a 3.7% interest rate. And thank you very much, Madam Chair.
Okay, I see Councillor Van Pass. Is there a seconder for that motion? I guess I should say first. Is there a seconder for the motion that's on the floor? Going once. Councillor Van Passen, I see your hand. I'm not sure what that means.
I'd like to ask the mover if we might make a slight change to that motion. That in addition to a one-time loan of $2.5 million, for 2021, because I still would like to return some of the money that was in a surplus, so that after the audited statements come in, that we apply any surplus left over from 2020 as repayment of the loan in 2021, so that like we can't send forth a budget that's not balanced. We have to show a source of that, but hopefully any surplus left over from 2020 would be enough to pay back that loan in 2020, and it would just disappear. If Councillor Michelle's be willing to add that as a second part to his motion, then I would be.
And Madam Chair, I'm very amenable to that that amendment, and unless there is some kind of comment that we get later from staff that that's not possible, but that would ultimately be what I would think is the ideal situation. So I'm certainly willing to accept that amendment. Thank you.
Okay. So Councillor Van Passen, you're obviously seconding that. Further discussion on that motion? Councillor Columbus, I see your hand.
Yes, I'd like to know what that brings our budget increase down to from 7.7%.
Madam Mayor, and I have the answer to that. It would, Councillor Columbus, it would, I received this information from staff, and I believe it was forwarded to all of us, but it would mean a levy increase of 5.5%.
Okay. Thank you, Tom. And could I ask a question, Madam Mayor, to Mr. Burgess? At noon today, I asked Shelley Darlington if she had any way of pulling a rabbit out of a hat for this discussion this afternoon. And I just wondered whether she came up with anything whereby we could reduce the budget further with respect to moving away from that 7.7, something to more reasonable. Would Ms. Darlington be in attendance at this meeting? I take it she did.
Shelley is online, so I'll see if she came up with any magic tricks.
Examples.
Thank you through the mayor to Councillor Columbus. So yes, I did receive the call from Councillor Columbus earlier today. We did talk about it in our chat room with our finance team. And certainly I think the direction that council is discussing right now is one of the items we sort of collaborated on this afternoon after that phone call.
Thank you, Shelley.
And Jason, are you or Shelley, Kathy, able to provide what the impact is to commercial?
Through the mayor, for if we reduce the amount by 2.5 million, the commercial rate based on an average assessment value of 569,700 would result in an 8% decrease.
An 8% decrease? I don't know what that means.
The tax, sorry, it's an 8% decrease in the tax rate for the commercial property. And that's a result of the business education tax being being reduced. We received notice about a week ago or so that the business education tax rates are going to be reduced for the businesses, but the residential education tax rates will remain the same as last year. So that's why you see a reduction in the tax rates for commercial.
Okay. Further, Jason, is that your hand up? I see.
I do.
Councillor Columbus, if you could put your hands down just so I can see them when they go back up again. Go ahead, Jason.
Yeah, I just wanted to, I will, if it's okay with council, I may want to, I understand the intent of Councillor Van Passen's motion, that the surplus be, dedicated to the repayment of that. I think I might want to just word it differently to get you to the same spot, but not hem council in. And I will provide a written suggestion for council on that, so that when the statements are finalized, then a report comes before council, including a recommendation for repayment of the loan by the treasurer. That way, if anything happens between now and June, we're not fixed to an amount and then we're doing a reconsideration. It's there so that it does trigger the decision. And if we have $4 million of surplus, then you can easily do the two. If we only have $1.5 million, but we have some other liabilities that have increased, we can make a reasonable decision at that point in time. It's very hard to predict 6 months out in the future what can happen, and to narrow to a certain amount may take flexibility away from council. So I may just jot something down for council to consider with the same intent that Councillor Van Passen had, but just a little increased flexibility for council.
How long did you need for the jotting?
Just give me 2 more minutes and I'll run it over to Councillor Van Passen's room.
Further comments while we're waiting for the change in language? Councillor Columbus, go ahead.
Yes, what about the sale of surplus properties that are owned by the county? We're going through at one right now. Can that be put towards offsetting the legacy loan?
Which is the one that you're referring to right now?
Right, one in Port Dover. I think it was the
medical building.
Yeah.
According to the previous council decision on surplus sales through last year's budget, half of it does go to reserves, and council could direct those items to it. And that's why it's easy once you get the audit statements done. It may not just be surplus from this year, but it may be some other things that council can direct over, and that's why a recommendation coming forward would be a little bit more flexible to council.
Hope that anything that we can put towards that's what happens. Thank you.
Councillor Huffman.
Thank you, Mayor Chop. Through you to Mr. Burgess, I don't mean to interrupt your jotting, but for transparency purposes, and I know that council, we've received emails on this, but excuse me, one of the big things in the public is, and I've had people ask this question, and so I'd like to be addressed in the public realm. Why can we not just replace what we borrow from the legacy fund with the $3.1 million that was spent on the hub? Could you please address that?
Thank you, Councillor, for that question. It has come up numerous times. The challenge is where the money was sourced from to purchase that it did not come out of a reserve. Council had budgeted $1 million for the purchase of land. The land purchase was larger than that. It was decided at the time that it would just come out of current cash. And once the funding announcement was done, a budget adjustment would be undertaken by council to take it out of a reserve. So there's no money to put back in a reserve because it was just a check from our checking account. It was an unbudgetary expense that council was going to take a budget adjustment once we knew whether funding was received. Because we received the unfortunate news that there was no government funding coming for this. We are trying to just to reverse that transaction. So it's like, you know, if I were to simplify it, you had a checking account, you issued a check, and now you're just redepositing it back. It's not impacting any reserves. I'm just going to take a leave for 30 seconds while I walk across the hall for Councillor Van Passen. So I apologize.
Councillor Martin, go ahead.
My question will be for Mr. Burgess, so I can wait until he.
Marty, I can take the question too.
My question for you would be, at the risk of getting in trouble here, I know that we've locked the budget in per se, with the exception of this, but when we look at topping up all of our reserves to undo the damage that's been done, yet also juggling taking on additional debt by borrowing from ourselves, what would the implications be or favorable arguments be for reducing overall contributions to reserve? Say we said, I'm just throwing this off the top of my head, say we made a reduction of 25% to all of our reserves. Is that a meaningful, like, are we potato here? We're borrowing from ourselves, taking on debt, not contributing elsewhere. I wonder, favorable arguments would be knowing that my perspective is I'm trying to not jeopardize touching the legacy fund because of the message it sends.
It is a potato. It you know, at the end of the day, you know, at the end of the day, even when the legacy fund and the funds of that are, you know, contained, our reserves are, you know, $6 million, even though our legacy fund 76 million, because, you know, we have a minus 16 million or whatever it is in our road reserve. We have a minus $5 million per year amount in our core assets that we know of for asset management. So, you know, what I equate it to, it's like saying, well, I got this, you know, I got my birthday money savings account, you know, and that's the legacy fund, and that's $1,000, and that's the money I saved up as a kid for all the birthday monies I had. And then I got a Visa bill over on the other side for $5,000. You know, I'm minus 4,000 in the hole. The $1,000 birthday savings account is nice, but it doesn't really do anything. So if we say, oh, we're going to borrow a bit more from the Visa, it still puts you in the exact same position. So it is, you know, if you were a business or a household, you wouldn't have 14 different funds that you're allocating to. You know, at the end of the day, you would consolidate them and say, I have X amount in debt, I have X amount in savings. And I might have some retirement RSPs saved, and you would only have 2 or 3. As a municipality, all these funds set up, that sometimes convolutes the, you know, the situation. At the end of the day, you know, what I say is we're about a $300 million organization. We have a levy budget over $200 million. We have a water and wastewater budget and a capital budget. And we have, once you take away all our commitments, we only have a few $1 million sitting in reserve. What we have in a reserve is a rounding error. So
I asked for a favorable argument, Mr. Burgess.
I'm sorry.
I guess the only difference is that the legacy fund is, the difference between it being a birthday fund is that it does preserve the credit rating and it does send a message to future councils, but really otherwise it's just saving here versus not touching there, or vice versa.
Yeah, and the credit rating argument, as I expressed before, we went out to the market this year. We don't normally go out to the market. We normally use Infrastructure Ontario borrowings, and Infrastructure Ontario borrowings does not use our credit rating. We rely on the rate proposed by Infrastructure Ontario. So I'm not saying if we went out to the market or it takes away our choices, that's still a benefit. It's just for the foreseeable future, we're probably dealing with Infrastructure Ontario. And whether we borrow from it today or not borrow from it today, staff predicted last year that we would trip over our technical lines and we would have a downgrade no matter what we do now. So we're in staff's predicting a downgrade position.
Okay, I guess my comments just in closing then on this motion. For me, it's I've said it before, but it's principle based. I don't want to touch the account. I don't like the idea of it. I don't like the message it sends. So although it is a reduced amount, I would rather see other methods revisited. And we weren't having the conversation about borrowing 2.5 million when we discussed the budget at large. And what if we were to make a 25% reduction to all of our reserve counts? Jason is saying it's potato, but from my perspective, we are standing strong. We're not touching the legacy fund, and we could then figure out a dollar value if we made a lesser reduction in all of those other accounts and our saving accounts. So I understand that the argument will probably be made that we've already locked in the budget and that's off the table, but that's just really a bit of an accounting or a procedural issue for me. So in sum, I won't be supporting it. I don't support touching the fund.
Councillor Columbus.
Yes, to Jason, are there any pandemic dollars coming back to the county for year 2020 or suspected for year 2021?
Just in transit, there he is.
Through the mayor and council, I could maybe try and attempt to help out just for a minute until Jason gets back. The 2020 funding, a lot announced, and I believe Jason did send out an email earlier outlining all the COVID funding that we've received to date. And as mentioned, finance is diligently working at a lot of reporting back to the ministry of how the funds were spent. And they've actually, it's a very short turnaround time at this time, especially when it's our year end and we're in the middle of budgets. And again, some of that funding may be returned if the expenses have not been incurred that support applying the funding against those. For 2021, we haven't included that in the budget. We took a very conservative approach because since we don't have any reserves, we don't have any savings that we can go to if the funding does not come through. I believe that there is some movement and some discussion that we will be receiving some funding, especially since COVID has continued on in January, February, and hopefully ending shortly. But the degree of funding that will be available, we have no clue at this time.
Thank you.
Further comments? Okay, there's a lot of hands that are up. So are those hands all still up, or we've all had, Councillor Martin, you've spoken a couple times now. Councillor Michelle, go ahead for your second time.
Thank you, Madam Mayor. I just do want to just remind council that with Councillor Van Passen's amendment, that once that surplus is determined, that would actually come off of the 2.5 million that I'm proposing. That would not have to be part of that larger interest payments that we'd have to make there. And Madam Mayor, just while I'm at this, could I ask our staff a question to Mr. Burgess?
Go ahead.
Thank you. Jason, is there any way that we could actually go back and move some of the items from the capital plan that we've already approved and put them into the following year to achieve some savings there? I'm thinking about those things like the crosswalks in Simcoe and those types of items.
There might be some possibility. Some of those I'd be careful with because we have applied for government funding because there was active transportation and there was other funding that we were applying to that the province had opened up. We'd have to go back and diligently look at it. But you have to remember that you're not going to save that much on the levy side, because if it's debt financed, all we're really saving is the principal and interest, which is only a fraction. And if it's reserved amount, it really doesn't, it's coming out of a reserve. So your implication is, the impacts might not be as big as you might not think. If you defer a $5 million project, doesn't mean it's going to be $5 million to the levy. And then you have the challenge of next year, having a higher capital budget most likely than you did, than you were planning on. So that, we could certainly do that, and we could, at any point in time in the future, you can always defer projects. As if you remember, when we had project overruns this past year, there was a number of projects that got deferred to make up the difference. You may be in that situation again in 2021 where we have to defer some, and we'd be in a position to better answer that.
Thank you, Jason. Thank you, Madam Mayor.
I guess, Councillor Michelli, I just question for you from myself. What makes you think that, the two, I mean, if you're going to offer help, what makes you think that 2.5 passing on a 6% increase during COVID is going to be enough versus the 8? Well,
Madam Mayor, it would be 5.5, because I think the numbers kind of do matter here. And my basic approach to this is that I don't think I would suggest this after all my rethinking of this if we weren't in a pandemic. But I've received some very, heartfelt emails and phone calls from people who are on fixed incomes, who are working in low wage and low income, jobs and circumstances. And while I certainly appreciate, and I must say I am very impressed, and I was very, proud of the way that our residents articulated their arguments on both sides of this topic. And I thought, I don't want to ignore those low-income people because, as I mentioned at the very outset, unfortunately, this can be also a little bit of a game of who can pay and who can't. And I would like to, again, with Councillor Van Passen's amendment, I think that this might be some middle ground that we can all stand on.
Okay, so just to be clear, because you said numbers matter, and I do agree, but what you're quoting is the impact of the residential owner. So I'm quoting the actual levy impact because different tax classes are affected differently from there. So my concern is still with those on a fixed income like you described, and we're still passing on a 6% increase during COVID following a year that's after 8.8. And if ever there was a time, to provide support to our constituents, I think this is it. I'm just concerned that's still not enough.
Yeah, and Madam Mayor, I certainly take that, and obviously, I've rethought my position. 2 weeks ago, I was totally with you. And I'm just trying to find some common ground that can actually work for everybody. And I'm leaving this to the good judgment of all of our council.
Okay, Councillor Van Passen, did I see is that your hand up?
Yes, thank you, Madam Mayor. Again, we have been dealing with this all through the budget discussions, that we have that double-edged sword, that we are trying to rebuild reserves. At the same time, we're trying to control costs. We are putting more money into reserves this year than has been in the past. And at the same time, we're still trying to provide the same services. I think our staff did an excellent job last year in controlling the budget. And, whether it was deferring some projects, whether it was getting better prices on things, whether it was thinking out of the box on how they went about things, that's the reason we have a surplus, or projected surplus in 2020. And in order to meet some of the concerns about the least amount of effect on our taxpayers, rather than put that surplus into reserve, I'd like to use it in 2021. But we're also got our hands tied by the fact that we can't present a budget that shows a deficit. So we have to show some source in the budget of where money would come from. And with Councillor Michelli's motion, we're going to do a one-time loan from the legacy fund to account for the amount we're going to spend. But at the same time, part 2 says, once we figure out what the surplus is from 2020, we will pay that loan back immediately. And to Councillor Columbus's idea, we could use any item like that to repay that loan and have it off the books by the end of 2021. And but I do have the wording as suggested by our CAO for part 2, that once the financial statements are audited, that the treasurer bring back a report to council recommending a repayment amount for council to consider in 2021.
Sorry, is that's the new motion you just read?
That would be the suggested wording from the CAO for my motion that I made, or the addition to the motion I made already.
Okay, did you want to read the actual motion then from Jason again one more time? It lost me that that's what was happening.
That once the financial statements are audited, the treasurer bring a report to council recommending a repayment amount for council to consider in 2021.
Okay, I think, Tom, you were the seconder to that. Is that the case? Or you had moved it? I guess he just brought it to
Yes,
impasse.
Madam Mayor, I'm sorry. I thought that was the amendment that Councillor Van Passen added as the seconder to my motion.
Okay, very good. All right, are we ready to call the question then on that? Councillor Martin, go ahead.
Just a point of clarification, could we have some language in there that specifies when the treasurer comes back that an amount, you know, as close to repayment is in full is articulated to council members, not just here's part of a payment plan or here's whatever we have at that time. I just want to make it very clear that as much of it, of the surplus as we possibly have, that is after it's audited, can be used.
Jason?
Well, I think staff are hearing the intent here, and I think, you know, council may have other challenges at that point in time. That's why it gives you flexibility. But the intent would be at least at that point in time, council will know what the actual surplus from 2020 is. They might have a better financial sense of where 2021 is heading, and it's totally up to council. We'll bring a report. We may make a recommendation, but at the end of the day, it's still council's decision of how much they want to send. My hope is, you know, that there is that the surplus is higher than the 2.5 million, and it's not, you know, it's a non-issue at that point in time.
Yeah, I'm not worried, to clarify my point, I'm not worried about staff, you know, squirreling money away or finding other uses for it. I just want to be very clear from when council, as a reminder, that this was our intent when we set this motion, and that if there is this full surplus there that could cover it, I think that it should be presented to council in a way that's like, hey, this is a reminder, pay this off in full, here's the amount. That was all I'm seeking. Commentary in that direction.
But I think to his point is you don't know yet where your financial trajectory is going to be headed and how this, you know, how even the vaccine rollout and so on is going to unfold. So why would you not want to see over the next couple of months? It's still the same council that's going to vote on the funds, and you can choose to do whatever you want in terms of repayment at that time. I think what staff is asking for is the flexibility at that point.
Yeah, no, I understand. I do agree with that, and I understand. I guess I just would like some kind of nudge in that report reminding council that this was the discussion. I would hope that obviously once the audited numbers come back, we will see what's available and see what comparatively to what we took it out of. But I just want to be very clear and make sure that we're honoring that direction regardless of what the dollar value is.
Yep, and we can put it in the preface of the report, or you can add it, you know, add the words with the intent of maximizing, you know, repayment. And council can flip it the other way if then they think that maybe maximizing is not the best way. I guess my assumption was council's memory and staff's memory should be pretty good from this debate.
I was thinking so too. We're talking a couple months away, not a couple of years. Councillor Van Passen?
Thank you, Madam Mayor. I'm not going to forget this budget debate till the day I die, I don't believe. But I think the intent is to, you know, they're going to bring back a report. At that time, if their surplus is higher than the amount so be it. Then that resolves the issue. If not, we can use Councillor Columbus's option of pulling some money out of that land reserve from properties that we have sold. Or if the projected problems and financial situation of the county come midsummer are going the wrong way, then the loan might have to stay in place. But it leaves all options open. It gives us a budget that is not going to be rejected by the province with having a hole in it. And we're allowed to move forward. And yeah, it doesn't keep everybody happy, but nothing we do ever will. And again, I can agree with Councillor Martin. It's a precedent. It annoys me, but it also sort of gets us a path forward with the hope that it'll all go away by the end of 2021 and we're back on sort of stable ground and heading in the right direction and know where we're going. So, I hope that this achieves sort of that balance that we try to achieve and gets us done with this process, and we can let our financial staff have a life again for a little while. So, thank you.
Any further comments? Kevin, if you'd like to call the vote, please.
Yeah, absolutely. Would you like the motion read from what I've got down?
Yes, please.
Okay. A motion moved by Councillor Michele, seconded by Councillor Van Passen, that committee approve of the one-time loan from the Legacy Fund in the amount of $2.5 million, and that as outlined on page 2-94 of the budget binder, the loan be assigned a 2-year interest-free period, followed by a 5-year amortization at a 3.7% interest rate, and further that once the financial statements are audited, the treasurer bring a report to council and recommend a repayment to the Legacy Fund for council to reconsider in 2021. I'll start with you, Mayor Chop.
No.
Councillor Taylor.
Yes.
Councillor Michele.
Yes.
Councillor Huffman.
No.
Councillor Van Passen.
Yes.
Councillor Martin.
No.
Councillor Columbus.
Yes.
Councillor Rabbits.
No.
The motion is defeated on a tie.
Okay, the floor is back open. Councilor Rapids, go ahead.
Thank you. And through you, it would appear that we've essentially defeated two alternatives. I mean, there was a third in that we either adopt a levy relief strategy, or not. I'm on 2-94 of our big binder, looking at the levy relief strategy. I wouldn't mind if staff could just maybe bring this council back to our deliberations when we're looking at sort of two alternatives. And it would appear that, I think procedurally it's best to deal with staff's recommendation. We've defeated one, we've looked at an alternative, but there was basically you're either adopting what's presented in 2-9 or there will be no levy relief strategy. And I think it'd be conducive to the debate if we just had staff sort of ground us with where we're at and see if there isn't a recommendation that they're recommending at this time.
Thank you. Through the chair, I'll start and finance staff can add. There was clearly two options presented in the budget. The one is mandate off approach, which meant a high tax increase or high levy tax increase to address the budgetary challenges that we faced, which that was after achieving $3 million-ish plus or minus dollars in proposed tax or budgetary savings. And that was a normal consideration You have to remember, I just want to go back one further step. Staff did propose something as a 0% increase, which had, more than 50 FTE reductions and much more significant service level reductions. Staff did not recommend that. We came with something that was closer to the 9% range, which we called rip the Band-Aid off. And that was a solution that was presented as an option. And then the other option that was presented was a levy relief strategy, where we, as we've discussed here, borrowed from one fund to buy time to find future savings to take care of our structural deficit. So the two budget options or the one budget option, as Councillor Roberts has said, is the tax the full amount that's required after the budgetary savings have been captured. So that would put us at, I believe, 8.8% levy increase to the budget. Well, if I screwed anything up, Ms. Fanning or Ms. LaPlante or Ms. Darlington can correct me on that.
Thank you, Jason. And I do believe you are correct. 8.8 and it's 7.7 for, I think, the average residential taxpayer on the average assessment. And I'm just delaying to see if staff did want to interject with any corrections. I think we're talking about the same thing. I honestly feel like, although staff were not recommending that rip the Band-Aid off approach, I feel like we're haggling down to that point. And I'd like to table it. Let's deal with the rip the Band-Aid off a strategy. It is something I'm willing to move. And if that is defeated, then we're talking about a different motion between the 2.5 and the amendments that were just entertained in that rip the Band-Aid off strategy. Let's put that on the table, deal with it. I'm willing to do that. And if it is defeated, we're talking about another number from our legacy fund, I believe.
Very good. Seconder? Councillor Martin, further discussion? Okay, Kevin, go ahead, Councillor Martin.
Thanks, Mayor Chop. So we've talked about the surplus, we've talked about the hub money, which I did hear the answer, but I do feel like quite often council just waives policies. That's exactly what we're talking about doing on next year with fund anyways. I also discussed earlier the reducing our contributions by, and again, open to suggestions. I said I was talking off the top of my head, 25% of all of our reserves that we've already that were already in the budget to be topped up. What if we do that and take some of those savings and apply it to a reduction in the overall levy? Councillor Columbus made a comment earlier about taking money from the council initiative reserve. These are not sustainable funding sources, but neither is the legacy fund. So in an effort to continue to reduce the overall levy, I'd like to have a bit of a conversation with some of these other funding sources and apply it to not touch the legacy fund, but to rip the Band-Aid off and do our best to try and help lower it this year.
Sorry, could you just provide clarification as to your point about the hub money of waiving policy? Well,
there's a preferred, a preferred account that the funds would go back into. You know, what's stopping council from saying that this should be allocated towards levy?
No, I think there's still a very clear misunderstanding as to the hub money. So in 2018, Jason, could you correct when the year was that the $1 million was initially levied for the land purchase?
That was before my time.
Council.
But yeah, Kathy LaPlante might correct, but I would assume it was 2018 or 2017, the $1 million was levied.
Yes, so that was previous council. Subsequent, more than $1 million was never placed on the tax bill. It was never levied for. That's the point that staff is trying to make. So the taxpayers never paid for that money. The reason was they drew it from a cash account with the idea that we were very uncertain whether or not we would actually get that provincial and federal funding. So there was no point charging it to the taxpayer if it was likely that we weren't even going to get the funding. And it was going to have to come back to council and be re-levied to the taxpayer at the time that we decided to move forward with the project, if we got the funds. So the taxpayers of Norfolk County, our 64,000 constituents, have never put a dollar towards that. It came out of a cash account, which is what we use to pay our salaries and so on to people. So when the money comes back, you can't put money that was never levied and now say, well, we're going to reduce the levy with that money, because it was never levied. Those were dollars that were levied in the past that were sitting in a cash account, and that was how they funded it. I believe it's been answered by staff several times now. That I see the misconceptions that are out there. I see even a former mayor, likes to peddle this theory, but that is not at all the case. You can't put money back in that was never levied. Councillor Columbus.
Yes, I just wondered how many dollars are actually in that cash account at any one time?
Actually got down to almost close to $0, did it not, Jason?
No, we've never been that close. We actually have a couple of high interest savings accounts that we move around. We manage our cash kind of on a weekly basis, and we actually passed out our cash. That's where the mayor is thinking. We used to present some cash forecasts where we would predict a zero or negative cash sometime out in the future, and that's when we know we need to move our investments over. I don't know where it is today. Tyler Wayne is on line. He's typing currently to give me a text message. But we're in a very strong cash position currently, and we have. I'm not this smart, but we have $25 million in our high interest savings account, and we have several millions of dollars sitting in cash currently. So we're cash flush right now, which is not uncommon, but you have to remember our expenses continue on throughout the year.
So can some of those funds not be moved over to offset this budget increase?
But they've never. It's a timing issue. We've levied it, we collect it, or the province has given it to us for us to spend. So it doesn't solve the balancing of the budget, because we have to, in a budget, we have to say, here's where our revenues are, and here's where our expenses are, and those two must equal. So we can't say, well, I had some savings from last year, and that's, unless we purposely say that's the reserve that's coming from. So the only reserve we were identifying from was the legacy fund, and technically that is even, the Municipal Act allows you to do that on kind of a 1-year basis. Norfolk County seems to have gotten away with it for a few more years, but technically you're not, as Councillor Van Passen has pointed out numerous times, we're not allowed to table an unbalanced budget. Our levy revenue must equal our expenses. So we can't just say, well, we got money sitting in our cash account, so therefore we can use it.
Thanks, Jason.
But I understand, I see social media, I understand you guys are probably getting pummeled by this, and people are saying, well, geez, this is a simple thing. So I get I get where you guys are getting pummeled by this continuously. It's unfortunate. It's just the way the Accounting and Municipal Act works.
Kathy, go ahead. Kathy, did you wish to speak?
Thank you, Mayor Chop. Sorry, I'm the first one probably, but left mute on again. So thank you. I just complimenting Jason's comments. I just wanted to make sure that we are cash flush right now. We did have a debt issuance, and we issued debt earlier than we normally would on a number of projects because the rates were very favorable at the time. So the projects are still and of them have slowed down a bit because of COVID, but we do expect the capital expenditures and the construction to increase again. And so it's just a little different than we normally, but normally we do not have, we're not as cash flush. Thank you.
Okay. Councillor Van Passen.
Yes, thank you, Madam Mayor. I'm trying to find that balance again And I think one of the reasons that the last motion didn't go through is the use of the word legacy fund. Don't want to set that precedent. I understand that. So I have a question for Jason. The final motion that we're supposed to pass today, one of the lines is that any surplus generated from general operations be contributed to the contingency reserve. Is it legal, legitimate to borrow or to fund our budget with $2,500,000 out of the contingency reserve to balance it and then have that replaced later on? And I'm pretty sure the contingency reserve doesn't have any money in it, but it seems that for years they've been borrowing or taking money out of reserves that didn't have money in them. But would that be a legitimate solution to our dilemma? We would still end up with a 5.5% tax increase. That's the balance between the 12 and the 0. It gives us a line item in the budget to account for all our revenue and expenses. And with all hopes, come the middle of the year when the financial audited statements come through, there'll be enough money put back into that reserve to net it out at 0. Was that a logical or legitimate plan?
I would like to circle with staff there. I understand where you're going, Councillor Van Passen. We might want to target it slightly differently if it was possible for me to slip away and have a 10-minute discussion with staff on potentially another option. However, all these options, we're just, at the end of the day, it all comes back to we're spending more money than we're taking in. And whatever we're doing to fill that hole is a temporary measure until we can get those two numbers lined up. So if it's okay of council, I would ask that I take some leave for 10 minutes. I'll circle with staff and come back with something along Councillor Van Passen's lines.
Yeah, I think there could be some confusion there. I think I don't think that was the problem with 3 of the councillors that voted no. I think it made a clear intention that they do support using the legacy fund, that it's just still not enough relief of what the proposal was. Councillor Hoffman, go ahead.
Thank you, Mayor Chop, for clarifying that. The word "the legacy fund" had no impact at all upon my vote. So it's regarding the individuals and the constituents in our community.
Thanks. Yeah. So why don't we take a break then, I guess, for the exercise of it all, if you wish to go, Jason, till 4:45, and then we'll come back and we'll take further questions from councillors. We'll take further questions when we come back.
Hi, I just have a quick comment. So I'm looking here at the minutes, and we don't for the motion that Rabbitson seconded by Martin, it says that no money be borrowed from the legacy fund, essentially, right? So we don't have, what we've done so far is we've said we're not going to accept borrowing from the legacy fund, and then we have defeated motion.
Yeah, Kevin, I understand they're trying to use that as well as find other sources to continue to bring down the levy while not using the legacy fund. So that's looking at an amendment onto the motion.
Fair enough. Thank you.
My question for staff, I would like to do a little bit of research on the break, is could somebody chime in with where I could find details on the Municipal Act concerning the finances on the cash information? Like, I'd like to do a quick Google search and get a better understanding of it.
It's an accounting principle, not from the Municipal Act.
Mr. Burgess said it's attached to the Municipal Act. It's a can't do.
I think Jason stepped away.
Yeah,
so
I think it's about section 270 of the Municipal Act.
270. Thank you. Okay, another question for clarification. So our cash holdings is not considered a reserve fund?
It's not a reserve in the sense that like you're thinking like our roads reserve and our
thing?
Yeah.
You're saying it's okay. Thanks.
All right. Councillor Ravitz, yes?
Thank you, and through you. Again, this was an attempt to get us grounded in the meeting and move the business forward. I am tabling the rip the Band-Aid off approach, and it was seconded by Councillor Martin. I think I do want to hear from our staff to get not only the response from what was brought up by my colleague during the discussion regarding his amendment, but I do want to hear from staff before I have an opportunity to speak to the motion and confirm my seconder.
Okay, I think we have been speaking to Jason, yes, please. Welcome back.
Yeah, thank you through the mayor to council. So I apologize, we did miss out on some of the conversation that was happening when finance was caucusing. I just want to level set the discussion again, just so that it's clear. So the challenge Norfolk County has, besides a weak position, is that we are spending approximately $5 million more than we're levying in tax revenue. So we have a gap, and I call that the structural gap. The rip the Band-Aid off solution was, well, you just raise your revenue. You tax that difference, you tax that extra 5%, that extra $5 million, and now you're equal. Staff recognize the fact that this might not be the best year to do that and look for a different strategy. The reason we proposed the legacy fund with borrowing bylaws was to, frankly, put rigor, like very strong rigor around the repayment aspect of it with borrowing bylaws, so it was a debt. That was an obligation that people needed to meet or go in front of the public and reverse their decision and pull it out. The only other option after discussing it with staff, if we don't want to touch the legacy fund with strict borrowing rules, is to touch another reserve. The only one that we contribute money to, we essentially levy about $9 million to put into our road reserve each year. Now it sounds like a lot, but our road reserve is at about minus 15 million bucks because we spend more on roads than what we levy. However, what council could do is move percentages and reduce the percentage of contribution to the road reserve to make up for this difference, or whatever difference council so chooses between 1% and 5%. I will say that it's not would like, and Ms. LaPlante can comment further on it, because frankly, underpaying into your reserves is what got us in this position in the long run. It's not transparent. There's no real binding authority. And once we take that away, then another council can choose not to then honor the contribution to go in. And frankly, we're falling behind on our road reserve because we're at minus $15 million. And, if the provincial legislation was in that said we had to meet our asset management obligations, we'd actually have to tax another 5% just to do that, because we're $5 million behind just on our core asset obligations. So my guess is we're probably 8 or 9% behind taxing to meet our asset management obligations. And 2024 is really not that far away, where the province may say to all municipalities, you must have a fully funded asset management plan. And that might mean another 8 or 9% hit to the tax levy. So with all that being said, the only other option staff can come up with is decrease your tax levy allocation to the road reserve for this year and contribute to this gap. And council, when we report back on our surplus, they can then decide to put that back into the road reserve if they so choose. But at that point in time, there's no boring mechanism. There's no bylaws around that. It's just very much a year-by-year decision. So hopefully that, I wish I had a better solution, but we've been working on this for months, and this was the best we could come up with.
Jason, I think just if you could provide, I know it's been sent in emails to councillors, but just repeat a little bit, maybe expand on what you just said. So in terms of using the legacy fund, how that is different than reducing that contribution to the reserves. Again, I know you just said it, but I think it bears repeating at this point, because this is being transparent. Unlike, the question is, how is this different than what went on in the past? Again, people didn't realize until a couple of years after the fact, there was no variance reporting. They were years behind on submitting their FIRs, that the corporation was running multi-million-dollar deficits, that they were drawing out of reserve accounts, and how this is being transparent. And there are policies in place, more policies in place with using the legacy fund as compared to really no policies in place with just simply saying, well, we're not going to contribute to reserves, which is much easier for future councils to do.
That is correct. The borrowing bylaw, which is what we put in as a requirement, is a legally binding document at that point in time on this council and future councils. That does not mean that this council or a future council could reverse that decision. But what it does mean is that if this council does it, they would have to do a reconsideration. If a future does it, they would have to have a motion passed publicly and to reverse that decision. So there would be public debate at that point in time. Where the allocation of reserves is done during the budget process, and it's not, I'm sure if I polled all the councillors today, how much were we actually putting in our road reserve? You might not know, because it gets very kind of convoluted. We might not know that we're actually putting $9 million into that reserve. So it can become very lost within a $200+ million budget. And that's why it was intended to put the discipline, not just on council though, I just want to be clear on that, but also on staff. Because I believe in tone from the top. So if council says, I have a borrowing bylaw, I must meet these obligations and I must find the $5 million in savings, and that is their legal binding direction to staff, to go and find the $5 million worth of savings. Because something's going to happen, something's going to bend. We're either going to raising taxes or not. So I think it sets a different tone to both council and frankly to staff to find that to meet the debt obligations. And I would say it would be no different, that borrowing should be no different than when we borrow money from Infrastructure Ontario or from Scotiabank or whatever. You meet your obligations or you take serious actions behind it. So that was the key difference around it. The other difference, we didn't want to go against the rules of the legacy fund. This would be viewed as an investment by the legacy fund, essentially. It would be an interest bearing account that they would be investing into, where they'd get the 3% or 3.45% back over time. So those are the differences, just moving reserve funds around. And so hopefully that adds some flavor to the discussion.
Okay, so in that case then, Councillor Roberts, can we leave your motion as is with no amendments? to it?
Through you, and if I may, I was unsure if I had a colleague that was proposing an amendment based on staff's response in that 15 minutes. So are we going back to the floor, or does my motion stand?
Well, I think you're hearing from your CAO and our finance staff that they severely advise going against that.
If I may, I'd like to reserve my second right to speak to my motion, and I do see Councillor Columbus has had his hand raised for some time.
Councillor Columbus, go ahead.
Yes, Madam Mayor. I wanted to ask Jason a question with respect to the road reserve item that he's raised. And I just wondered, does that affect any of the road projects that are scheduled for completion in 2021? I understand there's probably about 15 of them for 3 project managers. And I actually raised this on January the 6th. Similar question to what you're providing us now. So I just wondered if it affects project completions or whether it's actually just taking the money out of the road reserve.
I'll start the answer, Councillor Columbus, and Mr. Godby and Kathy might provide more detailed information. So the short answer is no. The road reserve is approximately minus $15 million today. So the inside joke here in the finance staff and you know, I challenge them all the time when they call it a reserve. I have trouble figuring out how minus $15 million is any kind of reserve. But so we've been running a deficit. I think that got as high as minus $20 million at one point in time. We've always had a deficit in it, so our projects would still go through. And so from a financial point of view, it wouldn't impact it in 2021. The concern is always, as you go further and further down the road, the ability to finance projects going on means more and more debt would be added. And I do recognize you did have a question with regards to only having 3 project managers, Councillor Columbus, and that's a question better directed for Jason Godby. I think I challenge Public Works each time on a budget to make sure that the projects we take on, we can actually move forward. If Mr. Godby is online, he can maybe have a comment as far as I know, we are on track to complete those projects as budgeted.
Thank you. So with respect to projects, for example, the asphalt resurfacing, Forestry Farm Road, Mr. Godby mentioned to me $2.2 million funded from road reconstruction reserve fund of $1.98 million for that particular project. So if that was not completed, that particular asphalt resurfacing, we would not be utilizing the reserves, and those reserves would be maintained in the reserve account, right?
We would still use the reserves. That reserve account would just go more and more negative. And at some point in time, we would then have to borrow more money, which is what we see is happening now. Like our debt and Tyler Wayne can correct me, our debt is scheduled to triple by next year from just a few years ago because of the reserves. So we would, you know, it's essentially you're just going to have de facto debt. That being said, if this council decides not to use the legacy fund but uses the road reserve, the treasurer's report coming back to council would be to direct whatever surplus is back into that road reserve, you know, which puts us back in the same position, or tries to put us back in the same position. But it won't be $5 million. Like the surplus is not going to be $5 million. The surplus is not going to fix this issue.
Thank you.
So I just want to make sure I answered your question, Councillor Columbus.
Yes, you did. Thanks.
Oh, sorry, Councillor Hoffman, go ahead.
Thank you, Mayor Chop, through you. It appears to me that there's a lot of roundabout discussion and you know, the ripping the Band-Aid off, potato, those types of things. We're looking at trying to solve the same problem by borrowing money from some account. So it's this stumbling block of this legacy fund, and and I have to reiterate what you had said, is that we've done this in an extremely transparent way. It wasn't that we were trying to hide anything from the taxpayers, from the general public. It's not a secret that we don't have the reserve funds. So if we're looking that we're adding 9 million into road reserves, but we're actually at minus 15 million, I mean, borrowing from there, that just makes talk about making no sense. That just makes no sense. That's even past the point of robbing Peter to pay Paul. So I'm very unclear of to why my colleagues are so heck bent and determined to avoid utilizing the legacy fund with looking at using the surplus to make that payment back. It just doesn't make any sense to me.
Councillor Van Passen, go ahead.
Yes, thank you, Madam Mayor. One of the problems I have with all these proposals, if we look at the projected budgets down the road, if we borrow $5 million from the fund, or if we don't borrow any money, in 2023, by borrowing $5 million, we will actually be collecting in taxes in 2023, plus the fact that we've put ourselves another $7.5 million in debt. We're still going to be collecting more in taxes than is borrow the money, because we have projected rates of 3.9, then 5.9, then 7.9. So we'll be collecting $120 million in 2023 anyway, and we can artificially keep them low right now, but we got to pay for it later. And I guess fortunately 2023 is a year after an election year rather than before. So if you're going to stick it to the taxpayers, you stick it to them after the fact. It's starting to look like American politics here. Trying to find some middle road where we're trying to be fair with taxpayers, with people's ability to pay, but there is that thing. We need 12% more money than we did just to pay for the services that we have now. We went through a long process. We're going to be cutting some services, decreasing some services. We've nipped a few percentage points off that 12. The question now is, do we raise it by the remaining 9% and bite the bullet and costed you? That's what we're going to charge. And or do we borrow some money, a little bit, split the difference, or just borrow it all? Why don't we just borrow the whole 70 million and really cut down the taxes? Like, again, the logic is the same. We're trying to balance being fair to our taxpayers with getting this financial house in order. And we're trying to rebuild reserves at the same time we're paying the day-to-day bills. And I don't want to go down the path that got us in this problem over the last 18 years before this council came on. But I also do have some sympathy. So there's been a couple of options out there to sort of split the difference. We're looking at a 5.5% increase rather than a 9, but it's 5.5 rather than a 3.3. Let the discussion flow from there. But, basically it's two options.
I have to say, Councillor Van Passen, I want to make this point. I actually resent those statements in terms of an election year. Nobody has taken more public abuse for the cuts that we have made and trying to restore the financial position than I have. So I don't make this decision lightly. I'm sure the abuse will keep coming for using this. But at the end of the day, we are in a global pandemic, of an emergency like we have never seen before. And we have destroyed our economy to protect a very small segment of the most vulnerable. And even if it is a very small segment of Norfolk County that can't afford a 6% or a 7% or an 8% tax increase this year, I'm willing to stick my neck out to do this because of that small portion of the population that has been more affected by this. We've spent hours arguing over hockey rates, over bunkhouse inspection fees, and yet there are people out there, there are a lot of people out there that have lost their jobs, and we are not out of the woods yet by any stretch of the imagination. It is still going to be months before a vaccine rollout is accomplished, especially given the ups and downs that we've already seen, and whether that is even going to be effective still remains. So, that's my position, and like Councillor Huffman pointed out, and I made a comment earlier, it's not to do with using the legacy fund or not for me. It's a matter of, I don't think a 6% tax increase is still palatable for a lot of people that are either on fixed incomes and they already went through a year of 8.8 the year before, or the people that have gone here and have lost their jobs, and even the businesses, even with the commercial tax reduction, those businesses are still struggling when they haven't had their doors open for a year. So I resent the suggestion that this has anything to do with an election period. You don't want to vote for it, or you don't want to use the legacy fund, that's fine. But I resent the insult that this is about something more, because I didn't go through all of this over the last 2 years to have a comment like that made. Councillor Martin, go ahead.
I almost forget where I was going to go here. We're talking about fairness, and there is really no fairness in this situation. Councillor Rabbit said it, we're left holding the empty bag, and Councillor Huffman is trying her best to balance something palatable, as are you and Councillor Columbus, and I feel like the options are being painted here like anyone who supports a tax increase doesn't support fairness, doesn't want to help constituents. But the fact of the matter is, I'm viewing it as today's obligation. This isn't something that we've built. This isn't something that we've asked for. And when we look at fairness and being equitable, just like Councillor Van Passen said, in the years to come, this is going to impact taxes later on. And we don't know what that next COVID is around the corner. We don't know. All of these things have just been thrown at us, and we've been trying to adapt and roll with the punches and represent and advocate for our community members. So what happens when that next thing comes and it's time to start repaying? So I just want to use this opportunity to say that even though it's I'm probably being viewed as being insensitive to some of these great points you're all making. That's not what I want to do or come across as doing, but it is the obligations of today, and there will be inequality with each decision we make, whether it's this year or in 2023 and onwards when we have to pay.
Any further questions, comments? Councillor Rabbits, you wanted to speak again, and then I think we'll move to the vote on this matter and then proceed from there.
Thank you, Mayor Chop, for my second opportunity to speak to my motion, and through you. I did want to make sure we're getting the wording right on exactly what I have tabled here and has been seconded with regards to the rip the Band-Aid off strategy. So this strategy is to not accept the levy stabilization loan from the legacy fund. I'll draw some whereas comments from our risk section to explain why this motion is being brought forward. And Kevin, if you are able to write some good whereas statements for that motion. Whereas this would represent a one-time revenue source, whereas there is a liquidity risk with this option, whereas there would be a credit risk with this option, whereas there would be a future taxpayer burden with this strategy, whereas this would represent a potential loss of earnings from the legacy fund with this option. These whereas statements were drawn from our risk section of page 2-96 of our original staff report. So, without amendment, this is the rip the Band-Aid off strategy. It is to apply that $5 million directly to the tax levy. And I just wanted to make that very clear. That is what we're voting on. That is what my intention was to table. And I do want to make sure I'm checking with my seconder, before we move procedurally to that recorded vote. Because I want to make my intentions clear that is the strategy that I am endorsing and tabling. The one that was not adopting this levy stabilization loan from the legacy fund.
You had me fully until you started to talk about the risks of the legacy fund. So just to, sorry.
Motion effectively on the table here is to not use any dollars from the legacy fund.
Correct. Okay. Yep. The second, I will continue. Thank you.
Councillor Columbus?
Well, I thought we already dealt with the legacy fund issue, and I thought that Councillor Rabbits proposed an 8.8% increase. The rip off the Band-Aid approach.
That is what he's got on the table right now.
Right. So there's no way I can support that 8.8%. It's just unaffordable for a lot of people. You know, business owners, seniors, the working poor, and especially the people at the south end that own those big cottages and homes on the lakeshore. They're going to be screaming also. Thank you.
That means, though, we have to keep finding more cuts next year. So, Kevin, if you could call the vote.
So, to be clear procedurally, what we're saying is we're not going to do what we're already not doing, right? So I'm just wondering, because could we just not change the net levy requirement and put the vote for the stack recommendation up forward now?
Okay,
I'm sorry, Kevin. I just must interject. I'm proposing to put the $5 million to the tax levy and end the debate. So if this is accepted, there would be no other amendments being proposed. And if this was defeated, we're somewhere between 2.5% and no strategy.
So for clarity, I think for the clerk, it would just be, you're proposing a levy budget increase to 8.8% with no, you could just leave it at that, which means for everyone at home, it means you're not using the legacy fund. There's no rate or levy relief strategy at that point in time.
Councillor Van Passen.
Yes, thank you, Madam Mayor. I think what Kevin is suggesting is that we just move to the drafted motion and just fill in the blank that we would need that levy requirement of $109,635.500, and that achieves that same result. Is that correct, Kevin?
That's correct, yes. So the staff recommendation would be that reports CS 2102, and then it goes on to say, and that the 2021 levy supported operating budget with a net levy requirement of it would now be $109,635,500. But I would also want staff to verify that, because there were some changes in the from the January 26th meeting with the bylaw officer, staff rejected staff $100,000 and all that. There's a little bit of changes there. So that's what in a nutshell, yes, I'm agreeing with Councillor Van Passen, but we would have to double check the number.
Well, that's what I'm thinking. Just for expediency purposes, you could just left the vote with Councillor Rabbits. I'm not, and then we can go back and fix the numbers and run that afterwards. Just that no funds be used from the legacy fund, so we can move on and not have to wait for staff to run the numbers, and then we can correct that if the vote goes through and move on if it doesn't.
Through the chair, I can give the number now, if it makes it easier. It's $109,735,600. And I'm not that smart. That's the finance team working that hard.
Okay, Kevin, if we could call the vote, please.
Okay. Starting with Councillor Rabbits.
Yes.
Councillor Columbus.
No way.
Councillor Martin.
Yes.
Councillor Van Passen.
Yes.
Councillor Huffman.
No.
Councillor Michele.
Yes.
Councillor Taylor.
No.
Mayor Chop.
No.
Motion is defeated on a tie.
Okay, so looks like we're somewhere now between, I'm going to say 2.5 and 5, but if we want to start at the bottom, that's your prerogative as well. I just think you've seen the appetite from a couple of the other people. So, Councillor Columbus, did you want to take a stab at it?
Well, I wanted to go back to that cash thing that Mr. Burgess spoke about earlier. Is there any way that we can utilize the cash amount that he said we were flush with at this time to offset this $5 million?
Yeah, so the cash is not an amount that was levied. In fact, a lot of the cash that's sitting there, as Ms. LaPlante had reminded me of, was from an early debt issuance. So it's actually coming from, a lot of it's coming from debt borrowed, which was for future capital projects. But I just want to remind council that whatever we have in cash or on the balance sheet's the balance sheet, and that's a residual of all the other budgets that have come before it. Today you have to decide on the 2021 budget, and the 2021 budget, the revenue must equal the expenditures or be higher than the expenditures. So using something from another budget, the after effects of another budget doesn't allow you to have that balanced budget. You can ask to pull from a reserve, and that's not best practice, but it's something you can do on a one-year basis. But you can't just substitute cash from other budgets into this budget. So, and I know that's out there, and it is confusing, and I understand that. It just when we look at the 2021 budget, you got to make sure your revenue and your expenses balance for this year.
I don't think it's so confusing. Councillor Huffman, please go ahead.
Mr. Burgess, you're the professional here. You've been in private business, consulting and everything, and you've provided us with some good information. We're at the loggerheads here, so can you help us out on the best way forward with respect to the quandary that we're in?
Councillor Clover, I think this is, I think if I go back to the summertime and the fall with internal staff discussions, we didn't have great solutions either. At the end of the day, we are spending significant amounts of dollars that we don't have or we haven't levied for. And I will say this, I have a tremendous amount of sympathy for this council, to be quite frank, because it has done a lot of the right things. It has reduced the deficits in the reserves. It has addressed asset management. It did a right sizing budget last year. It has taken some cuts to services to try to balance it out. The best two solutions staff came up with after months of debate, and finance staff was open about this, quite frankly. Some of the finance staff did not like the levy stabilization approach, but they concluded after months of trying to figure out some other solution that there was none. So I think you're at somewhere where we're either borrowing $5 million or taxing the $5 million or some number in between. And when I know I was quoted in the paper where I said this, I had one bullet left in the chamber. I haven't come up with any other bullets. That was the only bullet I had. So I wish we had something better, but we really don't. And it is a tough position. And I'm not deaf to the comments in the community, and I sympathize with the council, and it was a tough decision by our staff too. So I wish I had a better answer for you, Councillor Columbus, but I don't.
Thank you.
Councillor Huffman.
Thank you, Mayor Chop. Through you to the table. I think actually Mr. Bird just kind of took some of the words out of my mouth, is that we're back to where we started. There are no other accounts to borrow this from. to be mindful of the fact that we just can't put money that wasn't levied back in, like on. It just doesn't work that way. There's no road reserves. We don't know what we have an idea what the surplus is going to be. We can't take it from this flush account. That was probably, you should have let us know about that one, Jason, probably. But anyway, I would like to put a motion back on the floor that we go back to the original motion, and we look at utilizing the surplus funds when we get that, whether it be March, April, June. I know June is with the auditor, and we move forward with that motion.
I think, well, we've already defeated the one with using the full the staff's recommendation of the 5 million. So you need to target we can add that second part of the wording in for having staff bring back a report with the surplus to go to pay it down. But you need to pick another number.
Pick another number.
I guess whatever you want that number to be, just not 5.
Just not 5, that's right.
Not 5 and not 2.5 for the record. 2.5 was also defeated.
Yes, so those ones are no longer available on the board. I'm going to go with 4.5 million. So 4.5 million from the legacy fund, and we will utilize the surplus funds that are not yet known to us to make a lump sum payment back to the legacy fund.
Okay, if everybody could just hang on 1 second. I have Councillor Van Passen has gone off the screen. He's still there. Okay, he just says he's he's gone off the video because his Wi-Fi is struggling. So the language, Jason, for that second part of Councillor Huffman's motion, is that, I know it wasn't exactly as it was written previously, but is that sufficient?
Yeah, it'd be sufficient for us.
Okay, perfect. Is there a seconder for that motion? Councillor Columbus, you're seconding the motion?
What does that bring the budget, what's the percentage increase with that motion?
It would be approximately 4.3%. Are you, I'm sorry, yeah, it's 0.5% higher than what on the levy side, and I'm not sure what it would be for a household when we convert it.
So I'm trying to get the.
So it'd be 4.3% approximately would be what I would say. Catherine Fanning, Mayor, if you go to her, I think she has the information for you.
Hey, Catherine.
I will second Councillor Huffman's motion then. Thank you.
Through the chair to the councillor. So that would bring our budget to an overall increase of $405 million, which is a 4.3% increase over the prior year. That would bring the average residential tax rate impact to 3.8% increase. I was rounding there with the billions, so I can share it on the screen here. Just give me a minute, please. Okay, can everyone see my screen presenting there?
Yep. Okay, does that suffice, Councillor Columbus?
Yes, that appears reasonable during this difficult pandemic time. Thanks.
Thank you, sir. Okay, Councillor Martin, I can't see your face right now, but I saw your hand there. Please go ahead.
Thank you, Mayor Chop. Through you to all of council. I can't quite recall how Councillor Columbus said it. I think it was a nope or something along those lines, and I'd have to echo that. For me, this is very similar to where we first started out, and it doesn't change enough for me. And I remind you all of the correspondence we've received, and this takes $500,000 off that amount. So I won't be supporting it. Thank you.
Councillor Rabbits, please go ahead.
Thank you. Through you. We've defeated 5, we've defeated 2.5, and we've defeated 0. Now we're debating 4.5, and I'm simply too far away at this juncture. I can't support the motion. I understand that we're looking at drawing from the legacy fund now. I'm not a sore loser, and I'm willing to continue to debate, but I think I'm closer between 0 and 2.5 if I am going to endorse a motion at this juncture. It is the will of council, and I'm more than willing to work with my colleagues, but I'm simply too far apart with this figure.
Councillor Michelli.
Thank you, Madam Mayor. I am in the same position as Councillor Rabbits. I want to work with everybody, but that's just too much.
Anything further, Councillor Van Passen? I can't see you, obviously. I'm sure you'll raise your hand if you need something. Councillor Taylor, go ahead.
I'm in the position here looking at this where with having this payback from the surplus language in these motions, I am much more in favor of support a much faster payback period. I think I might still be a little bit too far away on the 4.5, but let's try 4 next time and see what happens.
Okay, anything further? Kevin, if you could please call the vote, sir.
Yes, Madam Mayor. Okay, so starting with Councillor Taylor. Sorry, I didn't catch that.
No.
Councillor Michelli.
No.
Councillor Huffman.
Yes.
Councillor Van Passen.
No.
Councillor Martin.
No.
Councillor Columbus.
Yes.
Councillor Rabbits.
No.
Mayor Chop.
Yes.
Motion is defeated on a vote of 5-3.
Councillor Taylor, go ahead.
I would like to move that we borrow $4 million from the legacy fund with the same language thereafter.
Can I have a seconder for the motion? Councillor Huffman. Kevin, can you call the vote? We've debated it to death.
Councillor Rabbits.
No.
Councillor Columbus.
Yes.
Councillor Martin.
No.
Councillor Van Passen.
No.
Councillor Huffman.
Yes.
Councillor Michelli.
No.
Councillor Taylor.
Yes.
Mayor Chop.
Yes.
Motion is defeated on a tie.
Why don't we take a 10-minute break? I'll resume at 5:40. Great. Welcome back, everyone. Kevin, I think I can run through the list, but I'll let you take a stab at it if you just want to look are no longer an option.
Absolutely. So we started off by saying no to 5 on a vote of 5-3. We then said on a defeated tie, no to 2.5. And then on another defeated, excuse me, on another defeated tie, we said no to 0. And then after we went to 4.5, and that was defeated on a vote of 5-3. And then we went to 4, and that was defeated in a tie. And then we went on break.
Councilor Michelle, go ahead.
Thank you, Madam Mayor. Here's what I want to do. Everybody, we all want to work together. I'd like to borrow $3 million, final offer.
Is there a seconder for Councilor Michelle? Councilor Taylor.
Madam Mayor, can we get him to repeat that? I couldn't understand it.
3 million is Councilor Michelle's figure. I'm assuming the other terms we'll all assume are the same, that we're looking at using the surplus and a report will come back from staff.
From the legacy.
Madam Mayor, thank you.
Correct.
3 million, the legacy fund?
Yes, and Councillor Columbus, that would approximately, I'll wait for finance to confirm, but that would bring it down, the tax rate for residences down to about 5.2%.
Thank you very much.
Further hands up I saw. Is there a seconder for Tom's motion?
Madam Mayor, I believe we have Councillor Taylor on that one.
Councilor Taylor, I'm sorry, Councilor Tom, it's a long night.
I understand.
Further discussion? All right, Kevin, if you'd like to call the vote in that case.
Yes, Madam Mayor. Okay, starting with Councillor Taylor.
Yes.
Councillor Michelle.
Yes.
Councillor Huffman.
No.
Councillor Van Passen.
No.
Councillor Martin.
No.
Councillor Columbus.
Yes.
Councillor Rabbits.
No.
Mayor Chop.
No.
Motion is defeated on a vote of 5-3.
Well, I don't know what to do. I mean, clearly we're at an impasse here. You know, if an 8.8% tax increase is what you wanted to be at this point, I'm not sure kind of what else to do other than to adjourn, and that's what it'll be. Councillor Columbus, go ahead.
Madam Mayor, just thinking here, if we found $3.2 million out of the cash fund.
You can't use money out of the cash account, Councillor Columbus.
We can't.
No.
Well, I was just thinking if we found it to put towards the hub lands, why can't we find it to put something that'll help all the taxpayers?
The hub lands would have to have been levied. They were going to have to be still charged to the taxpayer. It was an interim measure because the land wasn't done at budget time. And so there was no funding source for it. We put the clause in, the put option. It was unlikely that we were going to get the funding, but if we did get the funding, then we were going to have to levy that money still. This is a cash account that's used to fund our operations. This is money from previous tax years that goes into that account. Or like Jason said, most of the money that's sitting in there as a result of debt that's been issued to pay for upcoming projects. Councillor Huffman, go ahead.
Thank you, Mayor Chop. Through you to my colleagues. I'm not comfortable with going back to 8.8 and just being done with it. My suggestion is that we go back and we find more cuts. And I think that's the only responsible thing to do at this point in time. Clearly we need to be more prudent in our cuts. Going back to the argument over the Walsingham transfer station, we had a staff recommendation, and that was still not even followed. So staff recommended we need to come back. We need to find more cuts. We can't do 8.8%.
Jason, did you want to provide some commentary?
Staff had, staff had done up some work to do to meet to a 0% budget guideline. We can bring something back. I guess to narrow the field, however, because all these cuts are going to be tough. The last ones were tough, and all the ones will be tough. So, I think if we narrow the field, is it $1 million we're looking for? Is it a $2 million? Like, how big is the bread box we have? Because a $5 million reduction would likely mean another 30 FTE reductions, and that causes a whole bunch of other internal issues if I'm going back to look for that size. Or you can just direct us to go back and, like, if you would like us to target an amount, that would be preferential for us, so that we could the amount of work we have to do.
I think that's one of the challenges last time. We ended up going through the staff positions each one by one, but at the end of the day, I think we have to give staff a number as to what you want to target for FTE labor reductions. And we have to let the people that is their job and what they're paid to do, that understand those departments, they have to go and make those cuts. It's not for council to go through each department one by one. Can't look at the corporation in a silo. And they're seeing the big picture on how it all intertwines together. So I don't think we can go through another 4 days. I remember in our year one, we talked about the cost of even running these budget proceedings with 30 staff members. If we do this, we have to come up with a number that is sending staff back and allowing them to choose which FTEs they're going to reduce. Councillor Huffman.
My recommendation, thank you, Mayor Chop, through you. My recommendation would be to find an additional 2.5 in cuts, and we look at 2.5 from the legacy fund.
Okay, that gives staff better direction, so I appreciate that. I know it's a tough number to pull out your hat, but I do appreciate some guidance. Thank you.
Is there a seconder for that motion? I see a seconder for Councillor Huffman's motion. If there's no seconder, is there another proposal? Councillor Van Passen.
Yes, thank you, Madam Mayor. Yeah, it seems that we are stuck, but we're looking for options. But I will ask Jason, in the budget as it's presented, did we not increase the amount we are putting in the reserves by 3.4 million?
Through the chair, and finance staff was talking about this earlier today.
But like, we could put historic values into those reserves and not raise them this year, raise the amount this year.
Yeah, that's correct. We, like I said, we put, for example, $9 million a year, or $9 million is budgeted to go into the road reserve this year. One of the recommendations of staff was to take our growth level and put that into reserves for the asset management fund. So we can provide a summary of everything that's going into the reserves for you. I think staff may have that, or it'll take us about 5 minutes to pull all the different reserves that we're putting in. But you just have to remember that, and I'll use roads as again, we put $9 million in, but we take like $12 million out.
Yeah.
So,
yeah, I understand that. And again, it's that double-edged sword. But maybe with the concerns of a lot of my fellow councillors about the taxpayers' ability to pay. This is just not the year to start that process of rebuilding reserves. And if potentially there's an extra 3.4 million, I think it was, that we are putting over and above what we put in last year, and then follow that up with the difference between that and the 5 million, borrow it from the legacy fund with the terms and conditions that we pay that loan back from any surplus in 2020. And does that get us where we could actually approve this budget? It's not going to keep anybody happy, but it would be, like, again, maybe it's just not the right time to change that extra amount going into reserves.
Yep, and we can certainly go back and take. You end up in a very similar position that some council members expressed concern about, because the province is going to say by 2024 you have to figure out your asset management plan, which is right after the next council starts. And if you haven't saved anything for that, you're going to skewer the next council with a massive asset management liability that no one's put any money away for. So but we can take a look at that. I can one of the recommendations, and it was a recommendation, there was a series of recommendations by staff about no deficit in the budget, limiting the ARL to 15%. There was also a recommendation that all growth be put towards capital reserve until the asset management obligation was fulfilled. And I believe that, and staff can correct me if I'm wrong, I believe that was 1.4 million. If you defer that, if you move that over to reduce the levy rate, which is something that Norfolk traditionally did, they used their growth to offset their levy. Staff just corrected me, it's $1.7 million of growth this year. You can put that to offset that 5% gap. But you are now creating a hole for the next council to make up for asset management obligations.
Yeah, we are creating a hole, but the larger the loan from the legacy fund, the bigger the hole we create at the same time. So there is no win. It's, again, that balancing act of needs, wants, and ability to pay.
Yeah, the only difference I would say is that the intent of borrowing from the legacy fund was to be made up for with, was intended to be made up for with cost reductions, which would be sustainable. And, and then try to find other funding sources for the long-term asset management issues. If you, so my diligently, so we could get to 2.4%. If you didn't, we increasing the road reserve by $812,000 since we're in the hole, almost 15 million. So if you took that increase away and you took the growth away, that would be a $2.5 million reduction. If you wanted to do that, that cuts the 5% structural deficit in half. But on the flip side, your reserves are weakened. So if that would be the two reserves that if you want to go after, that's 2.5%. Now you're dealing with 0.5% hole to either increase the levy or borrow, a combination thereof.
Jason, maybe just for council, I'm just wondering if maybe some don't understand, but perhaps you could touch on the asset management plan that is going to be a requirement from the province that's coming up, and what exactly that means in a couple of years' time.
Sure. So the province has put forward regulations that all municipalities have to have a asset management plan and identify the infrastructure gap that it has, and there's going to be a requirement that the gap that they have, because it's anticipated that every municipality is going to have a gap, needs to be financed. The exact timing of when it's going to be financed is a little gray, but you know, most of the documents are saying 2024. That may get pushed a year or whatever. The challenge is most municipalities don't even know what their gap is. Our municipality did do their core assets, and this was delivered to council. And the core assets are roads or pipes or bridges, and that was about a $5 million annual gap we had. So just for those assets, we should be taxing $5 million more to afford the replacement of those assets. That's our core assets, and then we're doing the study for our non-core assets. Our non-core assets would be our arenas, our administrative buildings, you know, our libraries, our museums, all that stuff would be non-core. And there'd be a gap there. So we may be, you know, $7, $8, $9, $10 million more that we need to levy at some point in time to finance our asset management gap. That the stick that the province has and what they've said is that, you know, if you don't complete these tasks, they're going to take away your gas tax funding, and that is that's the motivational tool for the municipalities to complete these asset management plans, identify their gaps, and figure out a plan going forward. So it is something that, you know, for some municipalities with very strong reserves, it's not as big of a gap for them. For us, we don't have those, we're not in that luxury. So at some point in time in the near future, potentially 2024, we're going to have to start levying. We're going to be required by the province to fill those gaps in. So something this year. That being said, those are two, if the Councillor Van Passen's logic of not addressing the long-term gaps that we know that we have, if we're going to defer that, then that gets you 2.5% or $2.5 million of the $5 million.
Councillor Michelle, I see your hand.
Madam Mayor, my apologies, it wasn't raised.
Okay, is there anyone else wishing to speak? Councillor Huffman.
Thank you, Mayor Chop. Through you, this asset management thing, I know that a lot of the public may not be aware of it, but it's, you know, it's been drilled into our head now for, you know, a good part of the past year. And it's an important aspect that we need to pay attention to. I can't get my head around borrowing from the asset management as opposed to the legacy fund, because the word legacy fund doesn't sound palatable to some people. The asset management is an important thing that we need to follow through on. That can really put us in a big hole down the road. And I can't support going into the asset management, into the funds that are increasing our asset management.
Councillor Martin, go ahead.
Thanks, Mayor Chop. I just wanted to make a comment earlier. You had mentioned about staff bringing forward more cuts, especially related with the FTE. And I'm sitting here thinking about the cuts and the reflecting back on what we've just done and now where we're at and how that's really going to take a whole fresh perspective when we go back and look at making additional cuts. And I recognize that, and I wear some of that as well. But I guess I just wanted to say that although I recognize your point about not treating the corporation like a silo, we do have to make these decisions. I guess I still am interested in seeing, you know, FTEs on a staff in staff positions, not because I want to pick it apart, but because we are the accountability when people start knocking on our door, calling our phone and emailing us with the service level reduction. So I say that recognizing that we're all going to have to pull up our socks and continue to find some additional cuts here, and it's not going to be easy, and it wasn't easy before. But I still want to make sure that we're receiving detailed information, because we're going to have to answer those accountability questions to the public once we do make these decisions.
Yeah, through the chair, trust me, we would make it very transparent on these cuts. As far as what services and what the impacts and what the risks are going forward. So we would have a fulsome report back.
does that mean you're seconding Councillor Huffman's motion? Are you
Nope.
interested in going that route?
No, I would be interested in a deferral and having staff bring us back the previous options they've identified to get to their 0%. We can then look at cuts holistically.
I'm just
I don't want
to. Yeah, I just want to remind council of the conversation. So just round dollars, you know, more than 60% of our budget is, our controllable budget is salaries. And then the two biggest components of salaries is Norview Lodge and public health. I can't touch either one of those at this point in time. So that means all the cuts get concentrated, frankly, on a much smaller number of services that the county offers. So, you know, I do want to be transparent about that. And that's one of the reasons, you know, management recommended a 3-year kind of transition period into it. So I don't mind doing the exercise, and staff will do the exercise. It just, you know, I will say that this council had difficulty getting to the level of cuts the first time around. And, you know, it will be even tougher at this point in time, but maybe that's a valuable exercise that we go through it and we do it because we've hit that point where we are now willing to go back and look at other cuts. But I just want to remind council that a big chunk of our salary is kind of untouchable at this point in time for regulatory reasons.
Right, I understand that, and I'm hoping that in that 0%, maybe there are additional options also that were fleshed out that would maybe come back to us next year. I'm not sure what they are. I don't know if it's all salary related and benefits related, if it's all directly related to FTEs. I don't know that, but I would like to see it, given that we have just gone through this exercise. It is eye-opening for me anyways, but sorry, you just said something specifically that I wanted to comment on. To Mayor Chop, to your point, do I support Councillor Huffman's motion? I just don't want to close myself in on needing to pull 2.5 off of the legacy fund. I'd rather see what the options are, see what we find, and then decide. And her motion right now talks about 2.5 in cuts and 2.5 on the legacy. So that's where I'm not.
Jason, how would you like that worded?
To be quite frank, we could just take it, council direct staff to go and find $2.5 million worth of cuts, and then council can decide what cuts of those they like and how else they want to fill in the hole at that point in time.
I think the one thing though, council has to, if we're going to do this, I mean, we have already had 30 staff members, you know, sitting here now for 4 days. And I guess is this day 5? I've lost count. You know, we can't go through and pick away and go around in circles around and around and around like we did last time. I mean, if we're going to do this, there has to be a commitment to take staff's recommendations. They know their departments better than we know their departments. We're here to set policy and they are there to run the operational side. And so, you know, it's not for us that, again, you know, you can have a list of what staff positions, but they're presenting the ones that they believe with their knowledge of operations are, you know, the areas where they need to look at or they could look at for reductions. You know, I think it's like bylaw. No staff member wants to go and reduce their departments. That's a fact. But again, you can't keep looking at every department in a silo. So, did you just want that as direction then, Jason, since we're at a standstill, and then we'll reconvene? How many weeks did you want to be able to do that?
I'm going to, so my challenge is, staff was going to ask if a decision was made tonight to have a special council meeting next week, so that we can get the tax billings out, the interim tax billings out. I don't believe.
What was the purpose of the special council meeting next week?
Well, we called a Board of Health meeting. We could have added a special council meeting to approve the bylaws for the levy, to then levy the taxes for the interim.
I assumed they were going to be drafted tonight. I thought that was the plan. It was all going to be ratified this evening. Well,
we didn't know. We could have maybe come back in time, but yeah, we need to get the numbers right. So And I don't mind, like, if we're off on the first installment, we're off on the first two installments. It is what it is. It's not life or death. There's lots of municipalities that do that. I would suggest that you give staff 2 weeks, but everyone's recognizing that we will likely issue interim bylaws that would be based on 50% of last year's taxes, which means residents would see a larger chunk of the increase put off to the last two payments of their tax bill. So some might not like that, others might call that a bit of a deferral. So I just want to notify council.
Okay, so just looking then at my calendar, I guess the council meeting is on the 16th. I'm thinking maybe that is the day then that we should, start at 9 a.m.?
The 16th will be up to council to decide when they want to start.
Is that too soon, or did you want us to move an additional meeting on to the 23rd?
No, I think the 16th, we'll work towards the 16th.
Councillor Rabbits, you're the one that's, I understand your position.
Thank you. Through you, I think that gives me a sufficient amount of to put that request in to have it off of work if that's what you're asking. It's the short notice ones that just move it ahead by an hour or so, where I've kind of already set my calendar that are difficult for me. But if I need to book the day and I have 2 weeks notice, I should be able to make it work.
Okay, perfect. Rest of council, any objections to that then? 9 a.m. at the 16th, we'll reconvene. Very good then. If I could have, I guess I'm thinking Kevin will just do do we want to, there's no real confirming bylaw here. I think we could just do a motion to adjourn. Councillor Michelle, go ahead.
Thank you, Madam Mayor. I'm a bit puzzled. Are we not dealing with Councillor Huffman's motion tonight?
No, Jason said that he would take it as direction just to come back for
right.
Future.
Okay, thank you.
We also don't have a seconder for Councillor Huffman's motion yet.
Okay, I think we just left it because we're going to give it direction to staff here to come back, and Councillor Martin had concerns with the second part of the motion. Again, that's fair enough. We'll see what the number is that staff come back with.
All right, I understand. Thank you.
So Kevin, did you want to, I don't think there's any need really to have a confirming bylaw, but you tell me. Councillor Van Passen.
Thank you, Madam Mayor. If we're asking for staff input, is it possible to get a little more in-depth research into that concept that I put forward on something this council has not done for 19 years, and just not starting that process here by not increasing the amount into reserves? I do remember some of the last meetings on how much discussion and dilemmas we had on making cuts to the existing budgets. And, we're looking at, the entire museum budget is 1.7. We're just going to shut down all the museums, and that's still not enough money. We'd have to shut down another whole department. Maybe the option of not increasing something for one more year is a viable one, rather than putting staff through the process of looking for cuts that council will turn down later.
Through the chair, I would say that those were suggestions that were made to get to the zero budget, so we'll bring some of those back, and that included reducing transfers to reserves, and so we'll give plenty of options to council to consider.
Thank you.
Anything further? Okay, Kevin, do you have clarity on how you'd like me to handle this?
Okay, yes, Madam Mayor. I just want to note quickly that the deferral from January 26th was specifically only to deal with the legacy fund borrowing, and all other items in the 2021 budget have been approved, and any subsequent meeting we would require a reconsideration for them to be reopened. For instance, if we were to go ahead and find $2.5 million cuts, we will have to have a motion of reconsideration at the next meeting. And in terms of a confirming bylaw, we will require one.
Okay, could I have a mover for the confirming bylaw? Councillor Taylor, seconded by Councillor Huffman. All those in favor? Thank you. That's carried. And a motion to adjourn the special council. Councillor Michelle, seconded by Councillor Martin. All those in favor? And that's carried. And we'll see you back. The budget meetings then will continue at 9 a.m. on the, what was it? The 16th. And we'll next week for council and committee start time again is, Kevin, can you just confirm that?
For the 16th?
3 o'clock, correct? Or is that the one we're moving up earlier?
Next week's the 9th, and we were moving that one up earlier, and the 16th would still has remained unchanged from 3 o'clock.
But the 16th, we're going to start at 9 with the budget meeting.
Yes, correct, yeah.
And the 9th is, just clarify that, it was 1 o'clock?
The 9th will be 1 o'clock, yes.
Perfect. Okay, thanks very much. Have a good night, everyone.
Thank you, Madam Mayor. Good night, everyone.